In an increasingly aging society,
we face a double challenge.
How will we care for a growing elderly population
and cope with the shortage of healthcare workforce? This complex situation requires pioneering strategies and coordinated collaboration across the healthcare ecosystem.
Imagine if we were all in the right place, at the right time. Universities,
tech companies,
pharma,
insurance,
startups,
institutions,
hospitals, and investors.
Let's join forces to turn today's healthcare challenges into tomorrow's healthcare opportunities.
What's more revolutionary than turning innovative ideas into real actions that make a positive impact on society?
To change the future,
we must act now.
Be part of the revolution. Welcome to the Health Revolution Congress. Empowering.
Molt bon dia a tothom, muy buenos días, good morning and welcome everyone to the Health Revolution Congress 2024. It's a pleasure to have you all here. My name is Ruth Gumbau, I'm a journalist, I'm going to be your host and MC today, and I'm delighted to be spending the day with you at this fantastic event. Actually, many of you, I saw you yesterday at the charity dinner, lots of familiar faces, so thank you for being here again today. Today, we gather here in Barcelona in the spirit of innovation, collaboration, and determination to tackle the most pressing health challenges of our time with technology. The time has come. Let's start the revolution. Let's embrace the revolution. But before we start, I want to give a warm round of applause to Cristian Pascual, President of Barcelona Health Hub.
To Health Revolution Congress 2024. You see this, this is like a disco. I love this place, how it looked today. And well, last year we ignited the spark of the change in digital health. This year we will build the fire. Barcelona continues to stand at the forefront of digital health revolution, serving as a global hub for startups, healthcare professionals, tech innovators to converge to create transformative solutions. The potential we recognized years ago is now driving reality. Thanks to the support of the local ecosystem and the international community, we really see this evolving to something big. As we embark on this year's journey, I'm thrilled to witness the remarkable growth of this event. 2,500 tickets sold, 50 countries, 200 speakers, 85 companies. I extend my heartfelt gratitude to all participants, especially our dedicated sponsors. Can we change the slide, please? ACCIÓ from la Generalitat de Catalunya, Barcelona Activa, from Barcelona City Council, and especially to our main partner since the beginning, who is hosting us today in this marvelous space, Sant Pau and the Sant Pau Foundation and the Sant Pau Hospital. We also want to thank our Digital Health Revolution partners, the Revolution sponsors, and all the sponsors that has trusted in this event. This year, I would like to highlight our collaboration with Sant Pau Hospital in building a special agenda for healthcare professionals. I think it's really important to attract healthcare professionals to these events because we need to mind the bridge in between the reality of healthcare and what we are doing here today. We believe that digital health will continue to empower both healthcare professionals and patients, driving towards a more sustainable, scalable, and inclusive healthcare. And this is what I was in written. All the rest I will explain it my own way, because I think it's better. Thank you again to all the sponsors. And I wanted to start to tell you some words talking about some thoughts on digital health with this picture. I don't know how many of you recognize this, but this was the Bona Plata factory. This was the first industrial textile factory in Barcelona. I don't know what you think that happened to this factory. It was burned. It was burned by the Luddites, a movement of the traditional textile workers that just saw it as a threat, and they burned it out. So it's in human nature to fear change. And well, it's happening. We have change, we fear change, but in history, we can learn that on every big change that has made, it always happens two things that are pretty surprising, but we have a few examples. When horses arrive, cars arrive, we had a lot of horses, and it was pretty clear to understand what were the employments that were about to be destroyed. It was pretty simple, right? Because we know all the people working on the stables, on the carriages. It's simple to measure that. So everybody focus on what we are destroying, but nobody foresees what we are creating, which has always been greater. Nobody imagined that when cars arrive, just a full industry of tourism just flourish, or even the car industry that was pretty more understandable, but all the logistics and the commerce worldwide evolve. So, well, this is something that has always happened, and I think it's the right way to see it. It's always, when we have a transformative technology, it's always more what we get than what we destroy. And I think we are on a point today where healthcare really needs a step forward, because we are facing really incredible challenges. We have aging population. In Spain, this is the second more aged population in the world after Japan. So we have a lot of threats and challenges. Chronic disease, of course, goes with aging. So this is another problem, because it's an intensive work to be done from the healthcare industry. We have new treatments and diagnostics, and this means that we need more resources to provide them. If not, we'll not be able to deliver them. Also, we all have more health expectations. I want to play paddle at 80, right? So I demand more on healthcare to be able to do it. And we have a growing population. So all this together collides with another problem, which is the shortage of healthcare professionals. And the numbers are really big. This is UNESCO, well, I don't remember the source, but it's a prediction on the shortage that we will have in 2030. It's around 15% of the workforce. This is too much. I mean, we cannot afford it. And the only way we can balance this equation is with technology. We need to empower professionals and patients to clear the gap. What will technology provide to healthcare? We'll provide scalability. We'll provide time to look at the eyes of the patients. It's exactly the opposite on sometimes what professionals think. It will provide more time for them to treat patients as a human, as somebody that needs to understand what you are telling them. It will also provide new ways to treat patients and also new professions. We'll see in hospitals more tech workers, more engineers, because it will evolve. And we'll always and more try to keep patients healthy, instead of only treating them when they are sick, which is what we do today, right? So maybe in essence, what is happening is that, in my opinion, I'm sorry because my opinion is from an engineer, so I see it this way, healthcare has been just outcome focused. So when a patient enters a hospital, the only important thing is that we save the life or ease the pain, right? Okay, problem solved. Nobody has really looked at it from a process standpoint. So what is the efficiency of that process? How can we make it more efficient and have the same outcome? And this is, I think, what we will try to do together and what technology will bring to healthcare. And finally, today, I think you will see a lot of things. I'm really thrilled about the agenda, but this year we focus on collaboration. We will see 12 leading healthcare institutions working with startups, presenting together solutions. So we are not talking about innovation. We are talking about solutions that are already in the market. We just need to extend this use to other institutions. I think this is not just a Congress, this is a movement. Let's leverage this platform to share ideas, enjoy the day. We hope that the rain that we've been lacking for a long time doesn't fall all today. And well, just the future of healthcare is bright, and it begins with right here, right now. Let's get started. Thank you.
For your insights on innovation and technology. Now, I want to have here Miquel Rodríguez Planas from the Barcelona City Council, who is willing to give us a welcome as well.
Thank you. I was expecting to make a long speech, but Christian just gave us all the thoughts. So basically, I would like to welcome to Barcelona. We're very happy to have you here because we think that Barcelona is the place to be in terms of research, in health. And it is thanks to the startups ecosystem that we have, the hospital that we have, the private research centers and the public research centers that we have, but also thanks to Barcelona Health Hub that are helping and boosting all this reality. Barcelona is a capital of research in Spain. We're number is that, for example, just a few weeks ago, AstraZeneca decided to come to Barcelona to increase their presence in Barcelona with more than 2,000 jobs and 1.3 billion euros of investment. Examples like this show us that this is the path that we have to follow. And in this sense, from the City Council, we are willing to help you. And basically, I would like to just show you 4 policies that we're working in terms of help the research centers, the research ecosystems, and the health ecosystems. The first one is that we're investing in deep tech funds. We have a program of investing in deep tech funds. Deep tech right now, it's only 16% of the share of the market, but by 2030, it's expected to be 64% of the share of the market. So the future is in deep tech. We know that, and that's why we are investing in deep tech. We also have a welcome international desk to welcome talent. 25% of the population of Barcelona is now coming from overseas. We want you to be in Barcelona, be happy to be in Barcelona, to stay in Barcelona, to become Barcelonians. So we welcome you. We also have a program called Connection. It's a program to stimulate the transfer of knowledge from the research centers to the companies. And finally, we have a new program that we just launched a few weeks ago. It's called Crea Feina Investigadors. So I will translate to create work for researchers. That basically what we're doing is to help hire PhDs for private companies that want to hire PhDs in their companies. We're helping with an amount up to 15,000 euros per PhD. So all this is what we're doing from the City Council. We're doing much more things, but we really support the health ecosystem. And if you want more information, you have our stand of Barcelona Activa, our economic development agency, in the Congress. So welcome and enjoy this Congress.
Gracias, Miquel. Thank you, Miquel, from the Barcelona City Council for your valuable insights. Now, ACCIÓ from the government of Catalonia also plays an important role in this Congress, and that's why we want to meet now Joan Romero.
Hello, good morning. It's a real pleasure to be here today. First of all, I want to thank Barcelona Health Hub for inviting us to participate in this event, and thank you also for the long work that you do all over the year. I think it's amazing, and it's amazing the evolution that the life science sector and the health sector is doing here in Catalonia. As Miquel mentioned before, it's not a coincidence of having such an event like this here in Barcelona, here in Catalonia. Just let me show you some figures. For instance, we have increased the GDP in the sector above 8%, so we have rocketed last year. We have about 1,400 companies in the sector, 91 research centers, a big number of research in this area. And on top of that, we have received a lot of foreign investment. For instance, in the last 5 years, we have received more than 2 billion euros of investment, and we have created more than 5,000 jobs in the sector. Actually, in fact, Catalonia is the second region in Europe in number of projects and jobs created of foreign investment, just after Ireland. So this means that we are a real hub in Europe in this sector. And this sector is obviously increasing all over the world, and one of the main factors is the transition, so the digital health, the MedTech are the motors of this sector all over the world. And today we will have the opportunity, my colleague Ima Rodriguez will present in the framework of the health revolution a study that we have done of the digital health sector in Catalonia. And it's amazing to see that in 2010, we had only 30 companies related to digital health in Catalonia. Nowadays, we have more than 300. And if we only look at the figures of last year, we have increased 25%. This means that the digital health is increasing a lot in Catalonia, and this means that every player all over the world that wants to work in this area should work also and collaborate with partners here in Catalonia. The same way that the City Council is doing, we are helping a lot the sector. For us, the health sector is obviously a priority, and if we talk about digital health, it's also very important for us. That's why we are looking to help foreign companies that are trying to invest in Southern Europe to attract them to Barcelona, to Catalonia. But we also do a lot of different things. Startups are very important. They are the cutting-edge technologies for the sector. So helping deep tech companies, deep tech startups is also important. That's why we have programs like the Startup Capital Program that helps the startups in this sector. We have also an office focused on the next generation funds, trying to help companies that they are looking for funds for their projects to receive as much as they can to help this project. And we have also an office related to foreign investment. But we do a lot of many things. And for instance, in the framework of this health tech revolution, we are also collaborating in the Open Innovation Challenge that Christian mentioned before. 12 corporates, 12 institutions looking for solutions. We will have more than 200 meetings with 140 technology providers. It's an amazing way of finding solutions and achieving progress. Having said that, only I want to express my congratulations for the organization. I've been in many, many places, and this feels very, a good vibration, a good environment, and I hope that you enjoy this event as much as we will do. Thank you very much.
Thank you, Joan from ACCIÓ. We'll be meeting one of your colleagues in a few minutes, but first, let me call back Christian Pascual, because I think, Christian, you've got some surprise for us. Is that right?
Yes. Okay, so everybody's talking about AI, right? Artificial intelligence. How will change the world? Well, I think that sometimes technology impacts in ways that we don't imagine. And I want to share something with you, and please keep it to your eyes. Don't share it, right? I mean, what if Dua Lipa, you know Dua Lipa, right? Dua Lipa likes Barcelona, you know that. What if we asked Dua Lipa and Bad Bunny to do a song for us today? What do you think this song would look like? Well, you can hear it now. Can we put the video, please?
In the heart of Barcelona, where the winds of change blow, we're stepping into the future where the virtual rivers flow. Telemedicine is on the line, a lifeline so bold. Connecting doctors, saving lives, a new world to behold. To behold. Oh, we're dancing through that digital revolution's core. Artificial intelligence guiding one and all. Revolution in our veins, sparking like the stars. Healthcare's transformation, breaking all the monsters. In motion, we're singing out so proud. Barcelona will change its life.
Yeah. Viendo esta revolución, veo la sanidad avanzando con innovación. Tantos doctores que son los mejores, que son tan brillantes, los más importantes.
How tech can heal, how we can be free. Raise your voices, celebrate the health revolution, progress, it's our fate. Revolution in our veins, sparking like the stars. Healthcare's transformation, breaking all the monsters. Digital dreams in motion, we're singing out so proud. Barcelona will change its love. We're singing out so proud. Barcelona will change its love.
Well, this is, I think, a great example of how human plus machine collaboration can produce really incredible things. This is a good friend that does music and is capable of doing this with the help of the tools that are available today. It's not just a machine, it's this collaboration that produces these kind of things. And I really believe that we are near to see the next molecule that will ease a disease to be found by a machine real soon. So, well, just something to share with you, a funny thing to start and launch this session today, and nothing else. Really enjoy the show. Thank you.
So I don't know about you, but I never thought I'd see Bad Bunny talking about innovation. So that was really great. That was like a dream come true. Now, I would like to extend a warm welcome to Inma Rodriguez, the Market Intelligence Manager of the Executive Secretariat representing ACCIÓ. She's going to present us the Digital Health in Catalonia report. So whenever you're ready.
Good morning, everybody. It is a pleasure to be here in this magnificent space, Sant Pau. Now I'm gonna give you some data about Catalonia, about digital health in Catalonia, and it's really difficult to focus on data after seeing what we have just seen. I like very much Dua Lipa, for example, and wow, congratulations, Christian, was fantastic. Well, I'm going to present you today this report we have elaborated from ACCIÓ in collaboration with Barcelona Health Hub, to which I want to thank again for their contribution and support in this report. And well, today I'm going to give you some data. We will go from the beginning, from the definition. We're going to give you also some data about digital health in the world. We know that you come from many countries in the world, so we want to see the global picture in order to get to the part of Catalonia, of the ecosystem of Catalonia. Some of the main ideas I'm going to share with you today have already been given in the introduction, because we believe that Barcelona and Catalonia has the potential and the attractiveness to become one of the leading ecosystems in the world in terms of digital health. We will begin by defining what is digital health, although you are experts on the topic, so I'm not going to get into detail, into every detail in the definition, but just to give you some ideas. And one of the first ideas is that there is not just one definition of digital health. There is a plurality of definitions of digital health. And for example, you have here two definitions of two of the main international institutions, such as, for example, the World Health Organization, that gives a more general definition and says that it's the field, the knowledge and practice that associates technology in the end and health. For example, European Commission goes a little bit deeper with this definition that more specific, and it talks about the tools and services in which ICT can help to prevent diseases, to treat conditions, and in general terms, to give solutions to the health system in the world. So in the end, it's like the mixture of technology and health. And sometimes digital health is used as an umbrella term, let's say, an umbrella that covers and that has inside many other terms. And for example, we have here just some examples, but for example, mHealth, mobile health, it's of course related to digital health, inside digital health. And here we can refer to some apps some of you may have in your mobile phone to follow, for example, nutrition and diet apps, for example, medication adherence apps, and so on. In the case, for example, of telemedicine, I think this is also one of the terms that sometimes gets even confused with digital terms. And this is one of the important ones also, because we are talking here about the remote attention for patients, a trend that has been also improved and a little bit accelerated because of the pandemics, and in the end gives solutions through technology to the needs. We're talking also about wearables, for example, wearable medical devices in which we can, for example, control some symptoms, to make diagnosis, control, I don't know, for example, I bet most of you wear a smartwatch, no? This is a wearable, for example, that it's taking every minute, every moment, counting our steps, also, for example, controlling the heart rate and so on. In the end, digital health, and I will conclude here this introduction and definition part, digital health can help many, almost every player in the health system around the world. From the health system in general, enhancing, for example, clinical trials, helping predictive analysis through technology, helping also, for example, patient assessments and prioritization, no, when you are in a hospital, for example. Of course, it can help also healthcare personnel, and I think definitely they are one of the most benefited with the use of digital health, using technology through, for example, tools that can help them to manage patients, decision-making support tools, tools that can help, for example, to the analysis of medical image and so on. And of course, the patients. No? If technology can help you to the follow-up of chronic diseases, to have a better control of your medication, to have a better access and a better communication to your doctors. No? All of them, in the end, this mix of technology and health can make an easier world for all the players in this picture. Let's go now to give you some data about the world and about the expected growth of this technology that is digital health. And here you have an idea about the evolution of the market, of the global market of digital health. In 2023, the global revenue of digital health reached those $309 billion of dollars in 2023, and it's expected to reach those $939 billion by the year 2032. So we are seeing here a technology and a market that has a potential growth very, very high, as you can see here. And actually, it is expected to grow in the coming years at a rate of 13%. I'm sorry that you can see here some small movements in the slides. Technology helps us in many ways, but we just have a last-minute issue with the presentation, so I'm sorry, and I apologize for the little movements you see in some slides. Well, which things or which factors have made digital health grow in the last years and this expected growing rate? We have here a series of factors. For example, the evolution and maturation of a series of technologies. Artificial intelligence is one of the technologies that has enhanced this growing path, but other technologies are also linked here, such as, for example, IoT, robotics, for example, or telemedicine. And also the pandemics. The pandemics of COVID-19 has here an important impact because we had a need that needed to be solved. We needed a solution, for example, for the medical system, the health system to continue working in a non-face-to-face way in some cases. So technology was needed to be used and is providing and increasing this growing trend. In terms of at international level, we can see here the turnover, the market share by main geographical regions around the world. And as you can see here, 44% of the turnover of the market share of digital health currently comes from companies from Asia Pacific. In the second position, with this 28%, we have North America, and then Europe would represent this 19% of the total market share. In terms of countries, in the case of Asia, China and India are the two main players in this Asian market. In the case of North America, of course, United States. And in the case of Europe, main players would be, in terms of turnover, I'm talking here about turnover, would be Germany and the UK. And which companies do we have after those numbers, after those figures? You can see here in this slide the main companies in the world of digital health in terms of turnover. They are sorted by turnover, and the source here is Statista. You can see here some multinational companies from the United States, most of them. So most of the biggest ones comes from the United States. We find some European, like Bayer, for example, Siemens, AstraZeneca. But for me, the important lesson from this slide is if you have a look at the small flags of Catalonia, we have positioned at the left of some of the companies. Because that means that those multinational companies have presence in Catalonia. They are established here, and they are either doing research, development, or carrying high added value activities in our territory. So we are giving here a first idea of one topic that we are going to get a little bit deeper in a moment. This ability, capability, attractiveness of Catalonia to attract foreign investments in our territory. In terms of trends, technological trends, I will go very, very fast here, but we have identified like 6 technologies that make possible this growing evolution that we have identified in digital health in the world. This is not Catalonia, this is in general, but we have 6 technologies that will make possible in the coming years this path of growth of digital health. First one, of course, is artificial intelligence, AI, and I'm still impressed about the song we watched just a moment ago. Artificial intelligence, in the case of health, as you know, can be used in many, many fields of application, but for example, in the case of the design of new drugs and vaccines, it can help to prevent the results of the application of a medication. It can help, for example, to a better interpretation of medical image and many, many other applications. Second technology would be remote care, telemedicine, and this virtual assistant, this virtual communication between doctors and patients. This is something we are experiencing as a reality, and actually in a moment we will see some startups here in Catalonia that make this technology possible. Third technology we would like to highlight is virtual reality, and this is a technology that is being used in the health system in many ways also. From the patient side, in order to help, to be a support in treatments of diseases, the virtual reality is being used, but also, for example, for the healthcare personnel, for doctors, for nurses, there are some therapies which use virtual reality, for example, sometimes for stress issues, but other times for example, in the cases of treatments or prevention, or even making some operations for surgical issues. Internet of Medical Things was other of the technologies we just commented, and this is the connection of medical devices and technology to gather data that can be afterwards analyzed to diagnose a disease, to control a disease, etc. Privacy and cybersecurity would be also clear, because cybersecurity is, for me, like artificial intelligence, one of the main technologies, since it's necessary everywhere. From the moment we are connected to internet, from the moment we are connecting health and technology, we need to be secure. And that means that a good system of cybersecurity must be put in force to guarantee there are no cyber attacks, there are no losses of data, and so on. And finally, as a trend, we also highlighted the use of 3D printing, 4D printing for medical purposes, such as the design of new organs or tissues, human tissues, which is being like tested, and a new technology being put in force. Just before going into Catalonia, we are going, I know you want to enter into the Catalonia details. We are going to go here in a moment, but just very quickly, just a reference to some initiatives of digital health at international level, because digital health is at the agenda of every major organization around the world. This is not something we believe in. This is something, this is a need for public and private health systems around the world. And for example, World Health Organization put in force their strategy, their global strategy for digital health from 2020 to 2025, because it was an absolute need of health systems around the world to be supported. Also, the European Commission is identifying digital health as one of the challenges and as one of the technologies that must be supported. And European Commission also has analyzed that the application of digital health technologies can create savings in the public accounts up to 5.5 billion euros, for example, and also forecasts a growing trend in the coming years. In the case of Spain, the main initiative that has promoted digital health has been what we call PERTE for cutting-edge health. PERTE, it's a national program from the Spanish government that wants to foster the economic recovery and transformation of the country in a series of strategic fields. And of course, cutting-edge health is one of those strategic fields. And while this PERTE has invested more than 1,400 million euros devoted to the implementation of personalized precision medicine, to the development of advanced therapies, the digital transformation of the healthcare system, and other innovative data developments. But now we are going to talk about Catalonia a little bit further. And in those technological reports, normally what we do is we try to map the ecosystem. We try to map the companies that we have in Catalonia specialized in one specific technology, in this case, digital health. And always we do it from the supply side. This is important. So the figures you are going to see in a moment are companies in Catalonia that offer solutions to digital health sector in Catalonia. So they are companies offering solutions, creating new applications. They are not companies from the demand side, okay? So those are the figures that we have analyzed. In Catalonia, there are 331 companies specialized in digital health in Catalonia that generate a turnover of 592 million euros and employ more than 4,800 employees. Okay, so 331 companies with a turnover associated specialized to digital health of 592 million euros and more than 4,800 jobs. This is the second time we make this analysis. Actually, in November 2022, we gave some data about this ecosystem together with our colleagues from Biocat that I see here in the public. And the reality is that we have observed that it has been an ecosystem that is growing very, very fast, as we were seeing before in global terms, because from the end of 2022, the number of companies has increased 24%, turnover 35%, and jobs have almost doubled. So in Catalonia, things are happening, companies are growing, and new actors, new players are entering into the market to provide solutions. 91% of those companies are SMEs, and this is a figure which is quite common when we analyze ecosystem maps in Catalonia, because we are a territory of SMEs in Catalonia. this data here about 64% of the total of those 331 companies are startups. This is a relevant data, I find, because that means that more than the half of those digital health companies are startups. So we have here one of the key issues we are going to see in a moment. Innovation is often very related to startups that enter into the market to offer new solutions to the needs. So 64% of those 300 companies are startups. And mainly 18% of those companies are clinical tools, companies offering solutions for clinical testing and solutions. 80% are technological consulting, 12% are devoted to digital therapies, and 10% provide services for medical decision support. Let's see who are those 331 companies. Here you have the logos of the 331 companies. I know it's a challenge to see the logos. There are many, but this presentation, as well as the full report, is already public, and you can download the report from the ACCIÓ website and also from Barcelona Health Hub website. At the end of the presentation, I will give you a QR with the fastest access to the report. But in any case, for example, we said just a moment ago that most of the companies, 18 of the companies, develop clinical tools. Which kind of companies do we have here? We have, for example, companies devoted to online inquiries. And here, for example, we can highlight Doctoralia, which is a directory to find specialists in a specific health field, or Mediquo, for example. What they do is to provide a solution for doctors so that they can have this remote visit, this telemedicine access to, with their patients, to have virtual appointments. In the case, for example, of patient follow-up, we could here highlight companies such as Seniordomo, and what they had done is a watch, a smart watch for elderly people that allow patients, in this case, to connect very fast and very easily with the doctors and familiars in case there is something, some problems, some issue. Well, you can see here many companies. In the case of technological consultants, for example, just to focus that in these consulting services, as you can see, you may find here some companies that are general consulting firms, such as, for example, I don't know, Telefónica, Indra, or NTT, but they are here because they have some specific line of work devoted to digital health. Of course, we have other examples, such as Ernie, here down, which is a switch company, engineering company, just specialized in digital health. But we have here this mixture. In the case of digital therapies, I would like to, for example, to say that we have several examples here treating with mental health diseases in Catalonia. This is one of the interesting fields of analysis, such as, for example, Oliva, or Nixie for Children, Amelia, for example, and some of them even using virtual reality, one of the technologies we just referred a moment ago. And I cannot pass this slide without also making reference to the diagnosis companies, and of course to Medictor, no? The startup from Christian Pascual that through artificial intelligence identifies symptoms of diseases. No? Well, I just pick some examples. There are many of them. And as commented in the full report, you have the details of many other companies and success cases we have chosen. This private company ecosystem is supported also by an ecosystem of agents of support of institutions that make this Catalan digital health ecosystem rich and also makes possible all this fruitful, all this magnificent and attractive Barcelona as position in the world, as we are going to see. But well, we have research and technological centers devoted to digital health. Of course, we have like big ones, generic ones, such as, for example, Eurecat or Leitat, but here we need to highlight the importance of hospitals in Catalonia making this research in digital health, such as, for example, of course, Sant Pau, who hosts us today, but also Sant Joan de Déu, Vall d'Hebron, Parc Taulí, etc. We have 13 universities with specific degrees or masters in health that make possible the creation of the talent that this ecosystem needs. We have also some acceleration programs that make our startups and the startups that appear in the ecosystem to be growing at a higher pace. We have associations and networks of reference. Of course, Barcelona Health Hub as hosting institution here today, but for example, I would like to highlight the role of clusters here. We have several clusters in Catalonia, clusters of companies that promote and foster also health sectors, such as, for example, CataloniaBio HealthTech, that you will find here also in the program in this Health Revolution Congress, or, for example, the cluster WeMind that treats with mental diseases and neuroscience conditions. And finally, the role of the public administration, of ACCIÓ, the Barcelona Activa City Town of Barcelona that you have also knew before in the introduction, and Biocat, for example. Just a very quick also reference to the Center for Clinical Validation of Digital Solutions that was put in force with the joint effort together of Hospital de Santa Creu y Sant Pau Foundation and Barcelona Health Hub, because we believe this is a really good initiative, and this validation center support this co-design, testing, and validation of new solutions in a hospital setting. We believe this is a new opportunity for the digital health ecosystem in Catalonia to be creating, to be growing even more, to be creating new companies with new solutions. And now I'm getting out of time, as I can see in this watch I have here down, so I will try to go fast. But one final idea is that Barcelona is, in Catalonia, is a magnet for foreign investment. And the data we have here can help us to say this affirmation, because Catalonia, in the last 5 years, from 2019 to 2023, has been ranked as the 5th region in the world that has attracted the higher number of projects and investment in technological investments linked to the health sector in the world. So, 5th region in the world that has attracted the highest number of projects. Projects are here on the left, and the highest amount also of capital investment on the right in the world. This is something really relevant for us, and this is something, it doesn't happen in all the sectors. So Barcelona has some relevant issues, some unique settings that make possible that multinational companies such as AstraZeneca, that was mentioned earlier, but this has been one of the biggest investments in the health sector in the last years. And actually, the project they have established here is one of the biggest research centers in the health sector in Europe. So this is really a relevant investment. For example, the case of Teladoc, the American company Teladoc, that has also established here a technological health hub in Barcelona to provide telemedicine services. So in this case, really related to digital health. We have in Catalonia more than 9,000 foreign companies, but in a report that we made together some months ago, together with Mobile World Capital and the City Council of Barcelona, we identified that in Barcelona in Catalonia, we have more than 140 digital innovation hubs from multinational companies. Those technological hubs have two conditions, meet two requirements. They have established here in Barcelona to provide services at a supra-regional level. That means that they have established here their headquarters for Southern Europe, or for Iberia and Latin American markets, or even for the world in some cases. This is the first condition. And the second condition is that what they do here in Barcelona is research and development. They are developing high added value activities in our territory. And in the case of health sector, we have 13 of those technological hubs located in Catalonia doing this kind of activities. So multinational companies are choosing Catalonia to invest in the health sector and in the digital health sector, but we have also a relevant ecosystem of startups flourishing, creating new ideas. And in Catalonia, we have more than 2,100 startups, And here what you can see is that health tech sector is really relevant in Catalonia because it concentrates the highest amount of startups. With these 17% of the total startups in Catalonia are devoted to health tech, and also in terms of investment, in terms of funding rounds attracted, in this case in 2023, by startups in Catalonia, 18% of the funds were devoted to these same health tech startups. Here we have some examples of startups that have received funding rounds in the last years. I'm not going to stay long here because some of the examples have been commented, just to have an idea, but I will end here my presentation. I will end with this summary we have here. I would like you today to go out here of this presentation with these 5 ideas I have here. Maybe I'm too ambitious with 5 ideas, but we have in Catalonia, we concentrate a robust, a strong ecosystem in the life sciences sector in general, in which we have more than 1,400 companies. Around 17% of the Catalan GDP is concentrated in the life sciences, and specifically in digital health, we have those 331 companies we have commented. We have an ecosystem of startups really, really dynamic and that provide solutions with cutting-edge technologies. And actually, as we saw, 17% of the total startups in Catalonia are concentrated in the health tech sector. Catalonia is also attractive for the establishment of multinational companies when making their technological projects here in the health tech sector, and we are the 5th region in the world in terms of attraction of investment. We have local initiatives that promote also and that support the growing of this ecosystem, such as Barcelona Health Hub, Biocat, of course the strategy of the Department of Health of the Government of Catalonia with initiatives such as Salud, Artificial Intelligence, or the application La Meva Salut, and clusters. And all this ecosystem is also supported with an infrastructure of R&D that is excellent, with this network of research centers, hospitals, also universities providing talent, and making also Barcelona one of the main cities in terms of number of active clinical trials. So this is it. I think I came a little bit away from the time. I hope the presentation was interesting. As I said, this is a summary. You can download the full report at the QRs you have here on the screen, and you have also here my email in case you may have any question, any doubt. Thank you very much.
enough for these facts and figures. Now let's move on to our first round of Startup Stories Q&A. This is something that we're going to do several times this day. We are going to have the privilege of hearing from 4 innovative companies now. We'll be discussing their visions and contributions to the future of digital healthcare. So we're starting this first round of startups, and just so to let you know, most of the questions are going to be common for everyone. So I'm going to take a seat here, and now I'm going to call the first one, which is Prediction by Pedro Gambus. Please give an applause. So we're going to have 5 minutes for the 3 questions that I'm going to be addressing. And now the first one is, how is your company revolutionizing the current industry?
Thanks for the question, Ruth. And I want first to acknowledge the possibility to join the health revolution here in Barcelona and in this nice venue. Prediction indeed is revolutionizing the health system because we add a new dimension to the way we usually control and monitor patients. We provide the ability to predict what's going to happen with a particular patient based on the analysis of information that we have collected from thousands of patients that we have visited previously. And on top of that, we are clinicians also. So we know what are the relevant outcomes from a clinical perspective, and we know what kind of data we need to collect, how we need to analyze those data to give the clinician relevant information to decrease adverse events and improve patient safety.
So very interesting. Is there any collaboration within the ecosystem that you'd like to highlight?
In our case, Prediction is in a global ecosystem. All the companies which we will have and have any relation operate in the whole world. So whenever our solution will be placed in the equipment of any of these big companies, it will immediately deploy it in the whole world. Nevertheless, we work with institutions such as the hospital clinic, universities such as the Universidad de Navarra, local companies as well. But our scope and the ecosystem that we are involved in is not focused only in Barcelona, but the whole world is our limit.
So this concept of prediction that you propose in Prediction, how does it work? Can you explain it a bit further?
When we are facing a new patient, we try to use systems to control how the effect of drugs and therapies that we are using are affecting the patient. And we do this with systems that give us like a window to see what's actually going on right now. Our proposal goes one step beyond and takes into account the information from lots of patients that have gone through this same procedure before. And by analyzing this, we can provide a new dimension, which is the predictive dimension. So our goal is to make systems to control patients have a new dimension, which is predictive. So we want to create predictive monitors in this setting.
So thank you very much, Pedro Gambus from Prediction. We wish you the best of lucks.
Thank you.
Thank you. Now it's the turn for questions for Take McCarthy, representing Legit Health. Please welcome him.
Thank you.
So how is your company revolutionizing today's industry?
Yeah, that's a good question. So the issue that we are tackling is the insurmountable lack of specialists. So there's not enough, for example, dermatologists. So whenever you need to see a dermatologist as a patient, it's impossible to do it. This is a huge problem, but also because the GPs and the nurses don't have the knowledge that the specialist has. So what we're doing is we're using AI trained with the consensus of the specialists, namely the dermatologists, and putting that in the hands of the GPs and the nurses. And it's not simply AI, like it looks at symptoms or it's like a chat. It sees, so it processes images taken with smartphones and it tells you exactly what the person has.
Mm-hmm. Is there any collaboration with the ecosystem that you want to share?
Yeah, actually I would like to mention two. So collaborations are a great thing. Obviously we sell mostly to hospitals, care providers. We add the most value there, so both public and private. But we are seeing a lot of potential for collaborations, for example, with pharmaceutical companies. And we have a very interesting ongoing partnership with Boehringer Ingelheim, which is aimed at helping patients with rare diseases. And this would be difficult to do without the support of a pharmaceutical company. And something that also sometimes surprises people is that we also work with insurance companies because they want to make sure that the right patient sees the right specialist at the right time. So we have also an ongoing collaboration with DKV that has been actually pretty great. Yeah.
We're going to have a space for insurance also today here. So thank you very much. I'm sure networking here will also be very useful. Thank you and good luck.
My pleasure. Thank you so much.
Now it's time to welcome Monitoring Live, which is presented by Alejandro González. Welcome. So Monitoring Live, how is your company revolutionizing the current industry?
Good morning to everybody. Monitoring Live is revolutionizing cardiac insufficiency management by enabling daily cardiac monitoring for all the patients, no matter where they are. This is why we have developed SensoCore, which is a device that allows the patients monitor their illness and their evolution and be able to predict possible events. In 2020, the approach of how healthcare should be oriented told us that we have to focus more in technology and data. And in cardiac insufficiency, it's an increasing pandemic that right now represents more than 45% of all the deaths in the European Union. So through research, along with top doctors, we have proved that by the use of daily cardiac monitoring, we can reduce patient hospital admissions and the burden in public health infrastructure.
Mm-hmm. What collaborations within the ecosystem you would like to highlight?
We would like to share that we're partnering with IDOVEN, a disruptive company from the ecosystem, to come up with solutions to discover occult atrial fibrillation using our hardware and IDOVEN's AI Willem. We are happy that we are starting in hospitals in Madrid, and we foresee a success in this collaboration and an important advance in atrial fibrillation.
We also want to talk about challenges. What are the ones that you have to face in this past year?
Well, to develop a medical device as an independent startup, non-funded, the challenge is significant. To launch our solution to the market, we need to provide evidence, which means financing expensive clinical trials and also the regulatory part. So for us, when it comes to reach the funds to finance clinical trials, the first thing that capital ventures ask you for is to provide evidence when we actually need the funds for providing this evidence. But luckily, we have top doctors in our board and medical device experts that are helping us to overcome all these challenges.
Thank you, Alejandro. Good luck with Monitoring Live.
Thank you very much. You can see our stand.
Now we want to get to know Immersive Oasis, presented by Gabriel Serra. Good morning and welcome. So what prompted your company to venture into the healthcare sector?
It really was a chance because we have a partnership with Pico Interactive, And it led us to create a prototype for the WinFocus Association on training on ultrasound. And the physicians that try it, they enjoy it a lot, the prototype, and show a lot of possibilities in education with this technology, with immersive technologies. And made us realize that we can really create an impact in healthcare, and also it caught the attention of several pharmaceutical labs, allowing us to create a business and creating jobs in Asturias, which is our main goal as a company.
We are asking everyone what are the collaborations within the ecosystem that you'd like to share.
Oh, for sure. Talking about education and training, the best for us is with Daiichi Sankyo. Last year, we announced in this stage our collaboration to create Doctopedia XR, which is a truly connected and virtual campus for professionals and also students. Now, it's an international project. And by the way, now is the closed beta, and we are looking for testers. So if anyone wants to join Doctopedia XR, please come to our booth. And this year, we are very excited because we are moving into digital therapies. We are working with Héctor Beltrán from the University of Castilla-La Mancha, and also with José Ferrer, a friend of the Health Hub also from Barcelona, to start looking into technologies to release chronic pain, also helping families, and it will be the first step into a new journey in digital therapies for us.
Mm-hmm. What areas do you believe that technology will have the most impact on healthcare?
Well, it's fun because until yesterday, I will say in which area it can't. But yesterday, we were invited by the cardiology team in the Valdebron Hospital to share a workly day with the entire team and see their real needs. And I must say that maybe innovation companies, we need to start listening more to the community. But I'm sure of sharing knowledge and speed processes, made it simple, will be something that technology can bring. We all know what, for example, AI is doing right now. Also, something I'm pretty sure we all think is necessary, bring some order within the system right now. But as I say, maybe we have to start listening and strive to be more collaborative and less corporative to really bring the value that healthcare needs right now.
To bring the impact. Okay, so thank you very much, Gabriel, from Immersive Oasis, and good luck to you too.
Thanks.
So we got to express our gratitude to all the startups for sharing their insights and thoughts and their innovative work with us today. Thank you for all of you for your valuable contributions to our discussion on the future of digital healthcare. Your dedication and vision are truly inspiring. So now let's move to the next topic. It's revolutionary alliances, how DocLine is helping to transform MAPFRE health insurance business. We said that we were going to discuss some insurance business, so now it's the time. Let's introduce the challenge and solution concisely for you all. MAPFRE health insurance is focused on reducing waiting times to 48 hours while improving resource efficiency and customer satisfaction. They've partnered with DocLine to implement a virtual care solution that streamlines digital care workflows, offering services like doctor consultations, video calls, and e-prescriptions. This integration has expanded the MAPFRE Health app to include over 10 specialties, resulting in high rankings on both Apple Store and Google Play. I want to welcome Omar Najid, CEO and co-founder of DocLine, and Pedro Díaz-Yuste from Savia and MAPFRE. I'll let you discuss for the next 9-10 minutes. Thank you.
Thank you very much. Good morning, everybody. My name is Omar Najid, CEO and co-founder of DocLine. Thank you for coming today. I'm here with Pedro. Pedro, please introduce yourself.
Hi, nice to meet you. I'm Pedro Díaz-Yuste. I'm the CEO of Savia, the digital health business unit of Mapfre, and I'm also in charge of all developments in digital health in Mapfre Group.
Okay, let's see. Okay. Yeah, so basically today we are going to share with you the use case of how DocLine is helping Mapfre to transform its healthcare, the health insurance business. So thank you so much, Pedro, for joining me today to share this, some learnings with the audience. First of all, just a little bit of context and information about DocLine. We are a Spanish health tech enterprise company. From one part, we have an all-in-one solution, a tech solution, API first, video consultation, chat, e-prescription integrated with pharmacies, etc. And from the other parts, we have a medical network of more than 6,000 doctors, 20 specialties, etc. So during the last years, we did more than 2 million video consultations, 1.8 e-prescriptions, etc. And as I said before, we are connected with pharmacies as well. So please, Pedro, if you can.
Thank you, Omar. Well, regarding Mapfre, we are a global insurer based in Spain, leader in Spain and in some countries in Latin. Specifically in Spain, we have 7 million customers, and specifically in health insurance, we have 1 million customers. And we are here today because we are really sure that the future of the health insurance necessarily pass through digital. So we launched some years ago an initiative specifically in digital health called Savia, that today is the leading digital health platform in Spain, in order to learn how to interact with users and give our customers a better customer experience.
Thank you, Pedro. So basically, from our perspective, we see different challenges in healthcare sector. One of the most challenges we see it's the waiting list. From our perspective, from DocLine, we are working really on improving this waiting list, and we don't really understand why patients have to wait more than 6 or 8 weeks, for example, to see a dermatologist and or other specialists. And of course, there is other challenges as chronic diseases. As you might know, in Spain, more than the 50% of population, they have chronic diseases. So startups, digital health startups as DocLine, we are working on tackling those challenges. Please, Pedro.
Okay, and if you move these challenges, these healthcare challenges, specifically to insurers, all the health insurers have the same challenges, that are this kind of waiting list that's due to, after the pandemic, all the public health system is completely full of people, and they have lots of problems regarding waiting lists. So the private sector is being impacted for this. And I will say that the other big challenge that we have is to strengthen the relationship with our customers. The relation with the customers is really important for an insurer as far as the kind of services that we provide is with third parties, a relationship between patients and doctors, and we are in the middle. So we need to make stronger and better the relationship with our customers. That's the reason why we bet a lot for digital, and we wanted to have this relationship in a very close way. And if we are able to manage all the digital features in order to strengthen this position, and at the same time tackle with the waiting list and the rise of medical cost, then, well, it will be perfect.
Thank you, Pedro. So we are going to share with you how basically DocLine and Mapfre, we are tackling parts of those challenges. So we believe that we need to disrupt healthcare. We need to solve part of the problems with technology, with innovative solutions. So please, Pedro, go ahead.
So we present here the digital hospital of Mapfre. That means that from your app, the app that every customer of Mapfre in health insurance has in their mobile, we provide them with a lot of solutions. You can solve all the administrative tasks. You provide a lot of digital features. And one of the most important of this is this digital hospital. That means that for 10 different medical specialties, you are able to contact directly with a doctor in remote through video consultation, with the possibility to have a very good medical attention. Of course, you cannot be physically tested, but you have all the rest of the features that you expect from a medical consultations, and the satisfaction that we are having with this kind of solution is pretty high. And we're trying also to solve the problem to give a better customer experience as far as, for example, regarding waiting list, we aim that you can have this video consultation with more than 10 specialties in less than 48 hours. That it's, in Spain currently, it's a dream. Well, we are doing this kind of thing. We are able to achieve this kind of goals thanks to DocLine. And regarding the satisfaction of our customers is really high. In fact, today, the level of satisfaction that we have is the highest in the market. If you go to Google Play, if you go to Apple Store and see the different marks of the different health insurance providers in Spain, Mapfre is the leaders, both in Apple Store, in Google Play. That means that our customers are really happy with the kind of solution that we are providing, and specifically with the digital hospital that is being provided by DocLine.
Thank you, Pedro. So basically, we are this back office of the digital hospital. From one part, we have our doctor portal with different functionalities, with different features. As I mentioned before, video consultation, chat, e-prescription. We are integrated with 23,000 pharmacies in Spain and more than 15 features. And in the middle, we have an all-in-one API with more than 100 data points that basically allow our clients, such as Mapfre, to do a lot of business intelligence and to understand how their users and clients are using the products. And thanks to all this technology, as I mentioned before, and the medical network, which is very important for us, we have the most important digital medical network in Spain. So basically, we are able to embed this experience, these products in different apps, different platforms of insurance companies or other corporates. Next steps. I know that AI is a hype, but in our case, we see a real pain, a real problem, because we realize that doctors, they spend a lot of time doing admin tasks, paperwork, etc., and it doesn't make sense. So we are going to allow doctors to focus on consultation, on this video consultation, and we are going to capture this information and prepare a draft of medical reports based on this electronic health record and based on this conversation, and also a draft of e-prescription. So doctors, they will spend few seconds to check this information, validate it, and send it to the patients. And please, Pedro, I would like to know your vision about AI and how you see that solutions helping Mapfre in their business.
I think that the AI is the next frontier of digitalization. If you consider the different solutions in digital has been pushing up from the past, let's say, 20 or 30 years, and perhaps AI is the next milestone, really, really important. And for me, it's a way to give a better satisfaction to our customers. One final remark for me is that we, as health insurance, tend to be, wow, we are a main player, we have the possibility to do a lot of things by ourselves, and some people think that we are quite autonomous on that. But I don't think so. I think that if you wanted to take all the advantages that these technologies can give to you, you cannot do it alone. You need the right partners that are all the time thinking on this and that do a good job, as is the case of Docline. And this is the way for us to succeed in the more even competitive of the health insurance marketing in the future. So my message for the insurers, don't be alone. Go with the right partners.
Thank you so much, Pedro.
Thank you.
Thank you.
Thank you, Omar and Pedro. Next on our schedule is called Revolutionary Alliances Advancing Stroke Risk Monitoring with AI and Wearable Technologies. OneCare AI pioneers non-invasive stroke risk monitoring using wearable devices. Their AI-driven solution, backed by a successful European project, assesses stroke risk thoroughly by analyzing electrophysical markers, lifestyle data, and molecular evidence. Their collaboration spans hospital, telecardiology services, wearable manufacturers, and insurance companies, making significant strides in stroke prevention. Next, we're going to be joined here by my side by Davide Cirillo from OneCare AI, Daniele Lezzi from the Barcelona Supercomputing Center, and Jara Cárcel from Sant Pau. So the stage is yours.
Thank you.
Good morning. So the focus of our alliance is stroke. Stroke is a disease characterized by a neurological deficit caused by a sudden and focal interaction of cerebral blood flow. And if we speak about the consequences of this disease, we know that this is the second leading cause of death worldwide, and it is the first leading cause of disability. The cost of this disease is remarkable because of these numbers. We have that the cost is expected to increase by 44%, and by year 2040, it is expected to be higher than 27 billion euros. So our problem is that this large-scale stroke risk assessment is limited by the absence of effective tools for monitoring the general population and following up at-risk individuals. This is because we do not have a precise stratification of the population, we lack of integrated physiological and important genomic data, and the life potential saving AI tools require big data. And this is where OneCare AI, as things move a bit, gives us a solution.
Yes, with the OneCare AI, we are a spin-off of the Barcelona Supercomputing Center. We are developing solutions based on artificial intelligence and the HPC tools, in particular on stroke risk assessment. So our solution to the problem presented by Jara from Sant Pau, as I said, we are aiming at improving their stratification, the risk stratification, so providing a final stratification of the general population through the development of AI models that integrates not just physiological data as electrocardiograms, but also clinical information and above all multi-omics data that they are providing us. And also we are connecting with, we are reaching this general population through the use or the adoption of not invasive devices as smartwatches or wearable devices in general, in order to derive not invasive surrogate markers. And we are from Barcelona Supercomputing Center, so we are, our focus is to apply HPC techniques for fast and efficient monitoring of this stroke risk. So our prototype, actual prototype that we are implementing now, we are extending, is based on artificial intelligence model that we trained using large databases on the Mare Nostrum supercomputer at BSc, and these models are offered as a service, and they're available for prediction through the connection with the wearable devices, and the results of this risk assessment, of course, are provided to clinicians, to the doctors, to assess the stroke risk. We come from a very successful European project, both at proposal time, where we were first ranked, but also now we ended in March with the review, and we've been selected as a best-in-class project. So now we are starting this journey of our spin-off from the Sprint in collaboration with the Barcelona Supercomputing Center.
Okay, and currently our TRL is 4, and we tested the capabilities of our solution in a pilot study that we organized within the European project AI Sprint in collaboration with a stroke patient organization called Frenolictus, is the biggest in Spain, a very successful medical device company called Nubo, and also experts in the 12 de Octubre hospital in Madrid. So the pilot study was very interesting. We basically collected more than 9,000 hours of continuous electrocardiograms from stroke survivors and healthy individuals. And in this context, we could assess the integration of the AI with the HPC. We also implemented developed a mobile app for displaying the predictions and also assessing the privacy preservation mechanism that in all this is, of course, fundamental. And the next step is going to be this summer, a study, this time in a clinical setting, in the biggest hospital in Milan, Italy, the Niguarda Hospital. So, of course, we want to enhance our TRL, and in order to do that, we need funding. And so we are applying to a lot of funding opportunities. We are supported by the X4HPC network, and also we are currently involved in the pre-acceleration programs from Barcelona Activa and the Collider. And one example of the impact of our solution is actually the collaboration with the Sant Pau Hospital, and in particular to go beyond the electrophysiological information and the clinical information, which can, of course, provide this main source of risk factors for stroke, but trying to integrate also the molecular biomarkers. I'm talking about genomics, proteomics, and so here is basically what we are developing together, the solution that we are developing together with our collaborators at the Sant Pau Research Institute. And our team is composed of leading members that are Daniele and myself, as well as technical members, which are research engineers, experts in high-performance computing, biomedical engineering, and so on. And also we are supported by key opinion leaders and experts in the context of the Barcelona Supercomputing Center, but also in all the different collaborators and institutions that are involved in all these activities. You can check out our webpage, and also we have a booth outside, so if you want to know more about our solution, and if you want to know more about stroke risk prediction and prevention, we see you there. Okay. Thank you so much.
Thank you guys. Now let's talk about fostering data-driven patient care. Let's now step into the future of healthcare, where every heartbeat, every symptom, every recovery is thoroughly captured in data. In pharma's digital frontier, data is not merely information, but the vital link connecting patients and healthcare providers. It's transforming our approach to understanding, diagnosing, and treating patients. Join us in this panel as we get into the world of fostering data-driven patient care. This panel will feature Albert Ferrer from Novartis, Rosa Maria López Carnero from Boehringer, Francesco Gioni from Sanofi, and it's going to be moderated by Inés Perea from Mujeres en Pharma. They'll delve into this crucial topic.
No te puedes poner.
I'll be here. Morning, everyone. Thank you for being with us today. And welcome to the Pharma's Digital Frontier. It's a privilege to have all of you with us today to explore the transformative power of digital technology in reshaping the landscape of our industry and healthcare. We are living a transformative revolution fueled by the vast potential of digital data. The integration of digital technologies and the use of data-driven insights are ready to reshape the landscape of our lives, to reshape the landscape of pharmaceutical in a way we've never imagined. Today, we are living a transformative moment. And we have with us three great speakers, experts in this matter, from leading pharmaceutical industries that will share with us their experience, their learnings, their insights. So welcome.
Thank you.
Albert.
Thank you.
Albert Ferrer, Head of Business Excellence and Customer Engagement at Novartis. Welcome, Rosa Maria. Thank you for being with us. Head of Business Transformation Franchise and Business Operation at Boehringer. And thank you for being with us, Francesco Gioni, Global Health, AI, Platforms and Application Services Lines at Sanofi. I am Inés Perea, General Manager from Spain and Portugal, working for Just Pharmaceuticals, a biopharmaceutical company focused on patients with rare diseases and little hope. I am motivated by change and innovation, and I truly believe in the transformative potential of AI and technology, improving efficiency and driving better outcomes for us, in our lives, for our industries, and for the patients. Technology and AI are really transforming and changing the way we understand diseases, we diagnose, we invest, we research, we make decisions, we develop our medicines, produce them, and distribute them to our patients. And with little more, I would like to start the discussion and invite our speakers with a quite open question now. And it's for you three to share with us what is the approach to digitalization and AI in each of your companies. So,
well, I'll go first, if you don't mind. Thank you, Inés, for the kind introduction, and thanks to the Barcelona Health Hub for the opportunity to speak and organizing such an amazing event once more. AI and digital, that's a big word, and I would say this is very high on our agenda at Novartis for all the reasons you mentioned, in the potential that it has to impact patients' lives. And I would like to connect that to our purpose at Novartis, which is to reimagine medicine to extend and prolong people's life. And we do that. Our core is basically doing research and developing innovative treatments that alleviate society's most burdensome diseases like cancer or cardiovascular, and then making sure that they are accessible to as many people as possible. And digital and AI play a key role in enabling that. It's, I think, what it would eventually enable us to reimagine medicine And we're applying it everywhere in the company. We're applying it in research, in clinical trials, we're applying it in manufacturing, we're applying it in our interactions with physicians and payers and patients, because it allows us to have more efficiency, it allows us to have more impact, but more importantly, it allows us first to be disruptive in the kind of treatments or therapies we have. And right now, I would say we have 3 what we call technological platforms in the RNA, cell and gene therapy, and radioligands that probably we could not have had if it hadn't been for the digital and AI that we use. And it allows us to put those at the service of patients, right? And that's the combination of doing better research, doing it faster, and making it more accessible is how we use it at Novartis.
Thank you, Albert. Any, Rosmaria?
Well, innovation is a key part of our history in Boehringer Ingelheim, because we are a family-owned company that during the last 140 years, we are focused on innovation. In fact, our founder was very innovative a century before, doing things as paying vacations to the employees and generating value for patients from the beginning. Well, it's part of our DNA. We are investing more. We are investing more than 20% of our net sales in R&D. And taking into consideration your question, how we are applying artificial intelligence and innovation, well, it's part of all the value chains of the company. As Albert mentioned before, from the research, from the development, from the production, and also from the commercialization. But let me just emphasize in some point. It's true that technology and innovation is key in our companies. However, it's not the key piece for us. The key piece for us is to be patient-centric. And again, if you understand the patient unmet needs, you are able to provide the best technologies or the best approach for them. What is your approach?
So thank you for inviting me to the contest. Thank you for being part of this panel. At Sanofi, we have a real big aim goal that is becoming the first biopharma AI-based. And what it means from a patient perspective. So we talk about purpose, right? So the idea is really to accelerate as much as possible the value chain to get treatment at the patient level from drug discovery, accelerating large molecule research and clinical trials, manufacturing, supply chain, all the value chain process to get treatment to the patient. Really, the real aims and goal is really to halve the time that today this process needs in the pharma industry to get there. And how Sanofi is believing we can get there through, we say, through the miracle of science, of course, so focusing on science and research, but especially applying artificial intelligence, yes, all over the places in the chain, but also embedded as a culture in the company. So what I mean is, our CEO used these 3 terminology for artificial intelligence. Snackable artificial intelligence, that is what you use day to day, every employee to perform better his job and get to the final purpose result faster. Or expert artificial intelligence, where we were embedding skills and data scientists to build models, to build a system that will support different processes to get again to faster to the patient. And then generative AI use cases. That is a very, very particular area, because you cannot apply it to everything. It will cost too much. It will be, so we are really putting in place a kind of framework to identify what is the real value, added value at the patient level that will be generated by use cases with generative AI, and make sure that those use cases are the ones where we focus and we invest, not trying to boil the ocean, because that will be not following the purpose that we have in the mission, in the aims that we stated. So I think it is a very, very interesting journey, and there's what is important, and I think this is one of the key elements that we are putting on the table, is data. You cannot do AI without quality data, so the strategy to build a data foundation framework, one ecosystem with all data foundation across the value chain of pharma, this is one of the first goals to really being able to actualize AI-driven projects that will provide this value.
So, if I may, we see this with Francesco. Like, the problem of AI panels is that you can spend 2 days just talking about all the different implications that data has, and I'm sure today we'll have, I think there's more panels today talking about the use of technology and digital, but I sense a common thread here in how we approach this in all the pharma, I would say, regardless of the name of the pharma, which is, we're here eventually to talk about technology, but the underlying issue that we all have at our core is for whom we're doing it. So it's not technology for the sake of technology. It's always how do we put the patient at the center, as Maria said, and also Francesco, and making sure that this technology enables us to deliver on the patient, because we're all patients or going to be patients, and that's the important element that at least motivates all of us here.
Exactly. Thank you, Albert. And it's clear what's the difference of everyone that are attending this meeting is we are thinking on patient, be more efficient, become better companies with one aim, one purpose, and it's improve life of patients and families. And all of us will be patient. So it's clear that the basic of all of you have mentioned is how we manage also data. AI works for us and all the digital technology. We have to manage data and digital data from how we understand the disease to R&D, how we interact with our different stakeholders, how the patients interact with their doctors. So on this regard, what do you think, or how do you foresee the greatest opportunities in our ecosystem?
Go first, or?
What do you prefer?
I can go. Well, you go first. Come on.
Okay. The opportunity is clear. I think that to improve the health of the patients in the world, for me, it's one of the most important and transcendental visions. In fact, in Boehringer, we are transforming life for generations. It's our purpose as a company, and we are building this purpose in each stage of the company. Well, we can manage the technology and the AI in different parts of the change value, as we mentioned before, but it's important to understand that we are in an ecosystem. The healthcare ecosystem is key. We are just a part. We are not in the center. One of the things that we learned in the past decade, that we need to work together. We need to go together with the payers, with the administration. We need to work together with the patient associations. We need to work together with the startups and technology companies. This is super important because when we are affording technology, when we are trying to be innovative, one of the main paradigm shifts of technology is to include the patients, the doctors, the payers in our strategy and our execution. It means at the end that if you include this ecosystem in the purpose, you are able later to deliver a specific medicine for them, more efficient and more personalized. I think that one of the big opportunities is for the patient care purpose is to personalize the treatment in the future, not only taking into consideration the insights from our clinical trial, but also how we can exploit as a data assets the real-world evidence to be more to provide the safety drugs and also efficacy, and also to be able to treat in a good way to this patient. I think this data we manage, or we have this data together, and I think that if we understand this ecosystem with this asset of data inside the ecosystem, we will be able to provide better health at the end.
I think there is real-world data is becoming very important across all pharma. I think with the Gen AI, there is really an opportunity now, because even from a patient perspective, to generate synthetic patient data,
exactly,
be more precise in targeting the right patient at the right time, and enhance the efficiency of the drug, being able to combine different cohorts and commodities in a more simulated way. So generative AI plays a key role also in real-world evidence, especially if we were discussing, I think, before I was listening about privacy. Data privacy is one of the key elements that we need to protect, and we need to make sure that we are ethical in what we're doing, but we don't put at risk the privacy of the patient. And generative AI can really help also in this area, generating patient-like data that cannot relate to a real individual and put at risk the privacy. Yeah.
I think there's different time frames that one can consider on the impact of digital and artificial intelligence, right? And I think on the shorter term, I think we're going to see most of an impact in diagnostic of patients, right? Especially when it comes to imaging diagnostics. That's an area that definitely AI can supply the shortage of physicians or the long waiting list that we have. I think they really can help there. And I fully agree with Rosa Maria on the need there to do those kind of projects in a public-private collaboration approach, right? And here in Novartis, for several years now, we have people on the field working with the hospitals trying to implement those solutions. Midterm, then is what I think generative AI and traditional AI will have more of an impact on the drug development and research. And we do have there, for example, we just signed an agreement with Isomorphic Labs, Google subsidiary, to use AI to produce new compounds, to identify new targets, and there's going to be a revolution there, but due to the delay, it may take 5–10 years until we actually see the results. And long term, I always put this example of an excellent use of AI that we have today that I would love to see replicated in healthcare in general, right? And that's Google Maps. Probably all of you have used Google Maps to arrive here today, and I'm sure all of you have used it at least once in the past 2–3 days, right? That's the best use you have today. It's a clear use case. It makes your life easier. It tells you buses, schedules. It allows you to make reservations. Everything is condensed in one. So no one today has the feeling of being lost. I don't know how many of you are a bit older like me, and we meet at certain times somewhere, and then it turned out that you were meeting in two opposite sides of the street or the square, and then you go home and you didn't meet, right? So there's a whole generation that doesn't know what it means to be lost. So for me, when I think about the future, that's what I would love for healthcare. There is a whole generation that doesn't know what it means to have delays in the diagnostic. Today we have people that it takes 5 to 10 years to have a diagnostic with all the implications that this have in mental, physical, and family problems. So there's a whole generation that doesn't know what it means to be lost, that doesn't mean what it knows to go from treatment to treatment until they find the right treatment. So that's what I would hope for, and I do think it's feasible, not immediately, but in the long term. I think we should aim for that.
Yeah, amazing. And I'm building on what all of you have mentioned. I will add also all the supply chain and distribution that is already being impacted and is being improved by artificial intelligence, becoming much more efficient. So it goes from, as we said before, from even understanding the disease till the very last moment when the patient is treated, diagnosed, and even receives the medicine. So the added value is with us. And you've mentioned, all of you have mentioned that the collaboration with different companies, startups, because we can't work on our own. We can't do everything on our own as an entity. So how can healthcare providers, pharmaceutical companies, collaborate to ensure data-driven patient care is implemented in a way that is, as Francesco has mentioned, ethical, equitable, and patient-centric?
I think that we mentioned before, pharma companies have a big heritage in be ethic. We have a rigorous processes in our clinical trials, and also we have a robust processes to be very careful with this patient data, not only in real-world evidence, but also in the health clinical trials. And it's important to understand that this heritage, it's super important to be ethical, clear, and transparent with the purpose that we have with this data. Well, this heritage, it's one of the things, it's one of our strengths as a sector. No? And I think that the most important part here is to share outcomes, be able to generate early diagnosis, because early diagnosis it's important for society, for patients, for everybody. And regarding your question, I think that at the end, we need to strongly collaborate, public and private sector, and how to connect these two worlds. Well, in Boehringer Ingelheim, we have two ways to proceed. We have, firstly, internally, a BIX incubator. We have, in fact, a startup inside of our company. This helps us to understand how we can accelerate and to be agile with this early diagnosis with different solutions. But also, as we understand, as I mentioned before, that we are not alone in the healthcare ecosystem. We need new ideas. We need the velocity and the agility of the rest of the ecosystem, especially for startups and technology companies. Well, we started 3 or 4 years ago, more or less, with a strong presence in the Mobile World Congress to be in contact with these startups in order to co-create the future of the healthcare, and we have several projects. One of the most important that we are developing now is how we can improve the health of patients in a very ultra-rare disease that is psoriasis pustular generalized. It's until the moment without any treatment in the world, and how technology with a startup that help us and co-create with us is Legit Health, that we are more capable to diagnose this painful illness. It's something that alone it's impossible to do it. Another big example of that is we are in the area of mental health. I don't know if you are aware of that, but there are 1 billion well people with a chronic and complex mental disorder. That's amazing, because how we can contribute to this this big group of patients. Technology, again, is helping this mental health patient. There are a lot of opportunities helping them. So we are working on other startups, technology, in order to provide digital solutions and digital therapeutics to provide better patients' life care, and also how to understand and how to compare with our drugs with this other treatment that also are very robust. It's something that is tested also in a clinical trial, and the outcomes helps to improve patients' life.
Thank you, Rosa Maria.
I can go. So this way we change the order. It doesn't feel always the same order. So I fully agree with several of the things you said, and basically collaboration, public-private, is the key to everything within the sector if we are to really put the patient at the center, right? Because again, we provide drugs, but drugs is only one piece of the whole patient journey. So we have to make sure that we have this collaboration with the system, and system is not the hospitals. It's not only the hospitals, it's the hospital, it's the regions, it's the startups, it's the tech companies. Everyone is in the ecosystem, and we need to work together towards that. And then you said something, right? And I know there's a lot of concerns about privacy of patients, about will AI create inequalities, right? And that's fair. It's a true concern, and actually at Novartis, and I'm sure other companies do have the same thing. We do have a code of ethics in which we structure very explicitly, it's public, like how we approach this. And we're used to these things in pharma. I like what you said. We've been working for years in pharma with always any team has compliance people, has lawyers, has ethics in there that are considered. So it's not a new way of working for us. But then on this, there are some concerns which for me, because we know them, I'm sure we'll be able to address. But I look at the other side, which is actually the way to use technology, and AI can actually reduce inequalities in the current state of the art, in the current state of healthcare. And I do say that because, for example, in us, in cardiovascular health, we do have projects in the US, we do have projects in many cities around the world in which we actually analyze what are the factors leading to cardiovascular problems, leading to strokes, right? And zip code is one of them. And then we analyze using artificial intelligence, using data to make sure that every people, regardless of their zip code, regardless of where they are, can have access to the right physicians, to the right treatment. And that is only, we can only do that with a public-private collaboration. But if we are successful, we reduce inequalities. The same thing we do, for example, with EMR, right? Like for treatment of multiple sclerosis, for example. Like your level of diagnosis may depend on how many EMR machines you have, how fast the neurologist is able to see you. So technology can help there to, regardless of how many neurologists are in your area, you can get a quick diagnosis from many neurologists in the world eventually. So I think there's a fair concern on inequalities using AI, but we have to look at the opportunity to actually reduce inequality that it can create.
Thank you.
And yeah, and I think, of course, we are having a similar approach. But you both mentioned ethical use of AI. What in Sanofi we have been really focusing in the last 2 years is to building an ethical framework to make sure that we apply AI in what we call responsible way, a responsible AI framework to define very well where is the accountability, because the outcome of the output of AI, you need someone to be accountable for the result, and if there are bias or changes, that someone really needs to be in front of that. It's not just a virtual entity, right? Yeah. Safety and security, we mentioned privacy, we mentioned compliance, so this is something that needs to be assessed for every AI system or project that we do in Sanofi. The transparency means we take decision. Doctors will take decision with AI systems on patient treatment, on patient path, and we need to be transparent. What is the underneath an AI model that is driving you to take that decision? So the transparency, documentation, education of who is using AI system is very important. And last but not least, also eco-sustainability. Yeah. Because I don't know if, 14% of the all carbon impact is because of transportation, yeah. But data centers and computation systems and so on, they participate by 4%. Yeah. So it's a huge impact, and so we need also to be sure that we are assessing and make sure that we use certain computational resources when they are really needed and provide an added value to the patient.
Mm-hmm. Yeah. And linked to that, because you said something about accountability that I think it's key, and I think that's an important element we have to consider when thinking about the adoption of AI. We're at a state that the technology is there, the technology can work, the key barrier is going to be how fast and where we adopt it or not. And there, an approach we have, and from what you said, I assume you have the same one, which is AI is always used as a way to empower people. It's just not to replace, it's always to empower people. And then and I tell my team when we roll out also, we're trying to upskill our people, not to bring new talent, which obviously we bring new talent, but the key is going to be the current people working in pharma, the current people working as a physicians or like anywhere, they're able to integrate AI in their way of working. And I think there is, how do we show them that AI is going to help show their talent, how AI is going to use their time to what matters most, and then automate those tasks that are less value add, right? I think that's the accountability piece. There's always a human at the center, and AI empowers this human to make better, faster decisions.
Yeah. You've touched a very important topic, Albert, and it's the AI adoption. Mm-hmm. and the challenges we have as a sector, thinking always on the patient, being the patient-centric. So in your experiences, what do we new roles? Do we need new capabilities, new organization, new structure? How, in your experience, how we can approach efficiently and successfully the adoption of digital and AI in our organizations?
Well, I think that it's key to penetrate in all the organization. AI is important, as we mentioned today, in all the change value for us, but also in each part of the organization, because one of the things that I would like to add to the comment that you mentioned before is AI helps to be more productive, more efficiency, more sustainable also, but at the end, it's not a battle between human and AI. It's a combination, no? The mix and the hybrid model to combine AI with the human intelligence. Well, at the end, this combination needs to go together, and how to provide this knowledge that the important is the mix of two. In my experience, culture in the company is the first part. If you generate this culture in the organization in all the levels of the organization, because from senior management to not senior management, because everybody needs to understand, not only in the technical department, not only the commercial or the R&D departments, everybody needs to understand that we can provide better health if we understand this tandem between AI and human sense. One of the things that helps a lot is true that recruiting the right talent for accelerate the purpose, but don't forget people who work in the company with different generations and the diversity that we have in our companies. It's a mix, no? New and traditional approach.
I totally agree with the approach, and also ourselves, we are investing a lot in culture, as I said before. And it's not just acquiring the right profile and talent, but it's really investing on the people in the company to upskill and to be ready to adopt this culture, right? Of course, there are some key roles and talent that need to be part of that, especially if we say that artificial intelligence is a data-driven framework, right? So data engineers, machine learning operations, DevOps, so those are all roles that as much as we can internalize, we will get the knowledge and the skills then to spread out in the company this culture and then influence also the different stakeholders in the pharma healthcare environment to produce value with AI. I think this is one key element. Another element is also the, we mentioned accountability, but accountability also comes with education and understanding, right? So also the non-technical profiles or scientific profiles, they really need to understand how to assess the value and of an AI system and project. Because this is where we can really say, is building something for the patient or is just
fancy thing?
Yeah, and this is where, and I think this is going on in pharma, but in all the industries, is educational programs for senior executives and so on. This is something that is more and more coming in, and I think it's very, very important. If we want to speak about culture, to build a culture, you need to educate.
Exactly.
And this is something that is that those companies, our company, and I think all of us, we are investing a lot.
Totally agree with that.
Fully agree with the roles and the talent piece. You also mentioned organization, right? How organization set up we need to do. And I would say in terms of our organization, first, I don't think it requires major changes. Right? I do see a risk when you put suddenly, create a new unit only based in AI, only based in innovation. Those things usually do not work. Usually, you know, there's always exceptions. And I think here the key is how do you integrate those roles or those people that you need that expertise. I agree, you need to get new expertise and upskill the current people that they meet somewhere in between, but you need the new people integrated into the current way of working, which I think it works. Otherwise, you create a division that you limit adoption. Yep. But also, I think in terms of an organization, we've mentioned about collaboration, we've mentioned being like startups. So it definitely needs a new way, a more open way from pharma to look outside, to have people on the field talking more to physicians, and not to push solutions. I think in the past sometimes we did a bit of being too pushy in certain solutions. Let's not identify and create the solution on our own. Let's be more open on working with physicians, working with authorities, working with patients to identify the need, co-create the solution with them, and then you need some kind of new organization to be able to work on that, right? And you can see that all the pharma are moving this way. Eventually, you see that probably in LinkedIn, like open innovation challenges constantly going on LinkedIn. And I think that's a critical, how well you do that to make sure you play this key role in the ecosystem of leading this public-private collaboration with all the stakeholders.
Thank you. So if I can paraphrase you three, in order to quick adoption and successful adoption of digital technology and artificial intelligence, it's a shift in our culture. And then I guess must be top-down, so our senior leaders need to push, understand, and really support this evolution and transformation. And it's a balance of technology profiles. We need the technical piece and also understanding what is needed. For the technical people to understand what is needed from the science, customer, and all the different departments involved, and from all of them to really also know what can be provided by AI and digital technology. So, and then it's a matter of collaboration without massive changes in the organization that usually create more disruption. So, and then it's an amazing journey for all of us. Last question, and we have to be quick because we have 5 minutes left. Then we've mentioned in all this time we've been talking and discussing together startups and collaboration among different entities, public, private. So what will be your recommendation from your big companies? You have the expertise in big pharmaceutical companies to startups that are starting in this area.
Well, 2 quick ones. I would say the first one for startups would be make sure that you have this product market fit, right? And product market fit doesn't only mean that you're solving the pain point of one physician. It's an ecosystem, right? And you're making sure that you solve the solution in a broader ecosystem in the whole patient journey is there to ensure adoption. And here, a shout out to the Barcelona Health Hub for organizing this clinical validation pathway with the Hospital de Sant Pau. I think it's a great way to validate your need and use it, because it's very difficult to get this kind of validation in real life, outside of this track. And when it comes more to the relationship with startups and pharma, here I would say make your homework. I received plenty of emails, plenty of petitions to meet with solutions that cover disease areas that we're not in, that cover areas that I'm not responsible for, that cover all the way. And at some point, it's just do your homework, because otherwise you become spam, and then it creates a barrier for a very valid solution, and that would be a problem.
Well, you prefer? Only 3 tips for the startup that wants to be in this ecosystem. The ecosystem is hard, to be honest, because there are a lot of constraints for different processes, purposes, and also in terms of legal landscape. But for me, the first one is understand the patient's real patients' unmet need, because patients is in the center, and we need to serve these patients. Secondly, be resistant. As the ecosystem is hard, be resistant, but because in some moment you will thought, okay, maybe this is a solution I cannot do, maybe it's too complex. And related with that, my last tip for them is be brave. Don't lose this typical braveness of the startup, and challenge the industry, the administration, all the providers in the ecosystem, because our patients' needs.
I would say that my suggestion will be really focus on collaboration, because a startup is very lean by definition, right? Yeah. It's very, very fast failing and fast succeeding because they can change and adapt fast, where at enterprise level to make a change is always a big, big deal, and sometimes is challenging, no? And so I think the startup have the ability to accelerate and provide fast solution and ideas that at some point need to be industrialized and scaled. Right, and this is where the collaboration can come, because an enterprise is very good in scaling up and industrializing, where a startup is very fast and precise in identify and solve a specific problem. So the collaboration of the two is a winning factor. So my suggestion to the startup is not just looking at the problem they're going to solve on their own, but also how they can integrate and collaborate with the bigger companies and pharma to make it a wider scalable success factor. Yeah.
Fully agree with that.
Thank you. Seems we come to the end of this interesting time we've been together. So I would like to say thank you to Francesco, Rosa Maria, Albert. Thank you to Health Revolution Congress for this time, for bringing us together. And as a conclusion, I would say that digital technology and AI is not a choice. It's with us. And all the actors in healthcare have the responsibility, the accountability to really improve patient outcomes. So we have the opportunity to rewrite the playbook of healthcare system. And I invite you, all of you, to really move forward and go for more efficient healthcare systems and improve really patient outcomes. So thank you, everyone.
Thank you to you.
Thank you, Ines. There we go.
Please, if you will. Okay. Okay, thank you, guys. Thank you. So now let's transition to our next keynote session. It's called Women's Health, the $1 Trillion Opportunity You Can't Afford to Miss. It's presented by FemTech insider Catherine Falkent. This session promises to shed a light on the immense potential with women's health, and let me say, maybe the great forgotten in medicine, and why it's a market opportunity you can't overlook. Let's welcome Catherine Falkent as she shares insights into this compelling topic. Let's welcome her.
Lots of lights. Whew. So I was just saying to somebody out here that I'm incredibly grateful that Health Revolution Congress decided to put the Women's Health Talk on the main stage. I get to speak at a lot of conferences, and I'm always a little bit sad when it's like tucked away at some smaller stage. So thank you so much for doing this. To the organizers, thanks for putting together such an amazing event. And thank you for putting Women's Health on the main stage. So who am I? My name is Catherine Falkent, and I'm the founder and CEO of FemTech Insider. What does FemTech Insider do? FemTech Insider is the globally leading media platform for women's health innovation. Across all our platforms, we reach around 500,000 of people with our message of we need more innovation in women's health on a monthly basis. My clicker is not working, sorry. Oh, there we go. How did I get into women's health? Let's start there. So I actually don't really have a medical background. I don't have a pharmaceutical background. I really got into this as a patient. And it all started when I was still working for a tech company, actually for a financial tech company. And so during that time, I decided to do something pretty random. I decided to get laser hair removal. And so I kind of ended up in my beautician's office. And, you know, as I was waiting, I was just reading a bunch of flyers, and I was like, you know, this is interesting, what does this say? And it was like, well, you know, you actually shouldn't be going through with this procedure if you have a condition like PCOS, hirsutism, thyroid issues, because that's a hormonal imbalance, and so this is not going to work for you. You need to get another treatment, which is electrolysis. So and I was sitting there, a woman in my early 30s, and I was like, I was also under the impression that I, you know, had a pretty good grasp on my health, and I was educated around these topics. You know, I cared about my diet, I worked out. And so I was sitting there, and I was like, I have never heard of any of these things. And so I did what everybody does. I started to Google. And so I Googled PCOS, and, you know, all the symptoms. Here's a little bit about PCOS. All the symptoms made sense to me. I'm like, oh my God, I have PCOS. And, you know, all these things that I've been experiencing and that I've been struggling with, like, you know, sort of the weight issues, the hair loss, the bad skin, it all came together for me eventually. And so I took this flyer, I walked into my OBGYN's office at the time, and I'm like, look, you need to test me for this. I'm like 99% sure I have PCOS. And I had brought up these symptoms with my doctors in the past. I'm originally from Austria, and I've had access to excellent healthcare my entire life. And I was literally told, well, you know, all these things we're experiencing, they're cosmetic. Like, you know, what are we going to do about it? And so I finally got my diagnosis. And when I was first diagnosed with PCOS, again, I didn't know anything about it, and I also didn't know how common it was. So in fact, PCOS actually affects 1 in 10 women and is the most common endocrine disorder among women of reproductive age, and also one of the leading causes for infertility. And as you can read on the slide, a bunch of other somewhat unpleasant issues that come with it, including long-term complications like various cancers, cardiac disease, and also diabetes. So I was diagnosed with PCOS, and then I spent a year pretty much feeling sorry for myself until I finally ended up in a headspace where I'm like, okay, you know, I'm actually going to figure this out. I'm going to learn how to live with this chronic condition that I was just diagnosed with. And I will also say, actually being diagnosed with PCOS, it was a somewhat bittersweet moment, because on the one hand, I was like, well, I have a chronic condition now, that sort of sucks. But on the other hand, it was also quite a relief, because I was like, all these symptoms that I was experiencing, all these things that hadn't made sense to me, suddenly did make sense. And I was like, well, you know, I'm not causing these things. There's actually a medical reason, and I can actually tackle and handle this somehow. It took me a while, but I got there. So then I started to learn more about PCOS. And, you know, it's like once you start learning about women's health in one way or another, you start to go down that rabbit hole. And that's exactly what I did. And so the first thing I learned was that what I was experiencing on my PCOS journey was actually not an exception. It was more like the rule. Like the diagnostic delay of 10 plus years was what most women were experiencing. You know, the bad early care experience I was experiencing was what most women were experiencing that were going through similar journeys. And the same is true for a lot of other things: endometriosis, fibroids, anything with menopause. Women's health is just really incredibly underfunded and underserved. And so having that background from that tech company in the fintech space, you know, I knew there was so much written about the intersection of finance and sort of innovation. And nobody was really talking about women's health, something that arguably affects 50%, or if we also talk about reproductive health, 100% of the world's population, with this innovation lens. And so I was like, well, you know, if nobody else writes about it, then I guess I'm going to be the one that does it. And so this is how I ended up founding Femtech Insider. So I talked a little bit about my diagnostic delay. It took me 10 years to actually get diagnosed with polycystic ovary syndrome. And again, this is a very common occurrence. And I want to kind of point out this study that was done in Denmark a while ago. And so basically, for this study, the researchers analyzed 700,000 patient records and 700 different indications and conditions. And so what they have found is that for many very common ones, there are significant diagnostic delays when it comes to the diagnosis of women compared to men. And we're talking about very, very common things, like various forms of cancer. So for example, various cancers, a 4.5-year diagnostic delay. Something as common as diabetes, again, 1 in 10 people affected, 2.5 years later diagnosis for for women compared to men. So we really have huge issues with diagnostic delays. And what this essentially means is we're losing very, very precious time that we could be using in order to actually treat women with these conditions and help them, you know, kind of manage life in a better way. So I've talked about cancers now, I've talked about diabetes. And for many of you in the room, you're maybe going to be like, well, you know, women's health, but isn't that like about periods and pregnancy and the menopause? And I think what's super important for me to bring home in terms of that point is, you know, whether you know it or not, if you're in healthcare in one way or another, there's a pretty big chance you're actually also in women's health. And so what we all need to understand is that women's health is not the same as reproductive health or gynecological health. Women's health is also sort of conditions that affect women differently or also affect women disproportionately. And so we're actually seeing this here. The global disease burden, the global women's health suffering, is actually 50% of it is caused by conditions that disproportionately or differently impact the health of women. So why are we in this situation that, diagnostics are not, or diagnosis is delayed for so many women? Why are we in this situation that kind of the care is not really ideal? Well, it goes back to something that maybe if you're paying a little bit of attention to the women's health space as of late, is getting quite a bit of airtime, so to say. The so-called gender health gap. So the gender health gap basically means that we're having issues in terms of equalizing the field when it comes to research, diagnostics, care, and outcomes across genders in the healthcare world. And the next question, of course, now that we've established that this exists, is why does it exist? And the interesting thing is the gender health gap actually starts very early, and it very often starts with research. And so basically what we're seeing is in labs, or when we're testing new medical devices, when we're testing new drugs on people, it's a little bit challenging because lots of researchers opt to only include male participants, or in the very early stages, male mice, to test their innovations on, simply because it's a little bit easier because there are no alterations caused by hormonal changes that occur naturally with a woman's natural cycle, basically. And the kind of ironic thing is that we actually need these challenges and these alterations to occur in order to understand how various drugs actually impact women and men in different ways. It's been well established that women are not just smaller men. There's more to this. And so we really kind of need to do better in terms of making sure that clinical trials, that, the way we test new technology, we test new innovation, or even, drugs that have been on the market for a while, kind of addresses that. And I really want to drive the point home. So at the moment, there's many, many drugs in the market, and, it's something that we take on a very, very regular basis, like painkillers or digestive drugs, or like also sleep aids. And my favorite story is actually there's a painkiller that's specifically marketed for period pain, and none of these drugs have ever been tested on women. So we're taking a lot of things where we actually don't really know what the side effects are on women, or how they affect women in different ways. And this is obviously a pretty big issue. So we have this research gap. So how does this play down? And I will kind of remind you of what I told you a little bit about my PCOS story from earlier. So PCOS, again, we do not really know what causes PCOS, and we also do not really have a cure. So there's a lack of research, and we don't really understand it. So this then trickles down into a care delivery and an effectiveness gap. And so what we are seeing is that, okay, the DALI one, I actually tried to remember that right before. It's disability affected life years, in case you're not familiar with the acronym. But basically what we're seeing is that women are much more affected by these healthcare inequalities, simply because, we don't understand these conditions properly, and then this causes kind of the data gap and also the care delivery gap and the effectiveness gap. And this is obviously a big issue. And you're maybe like, well, Catherine, but this doesn't really make a lot of sense. Don't we always talk about how women actually live longer? And that is true. We do live longer. Yay, us. But at the same time, we also need to understand the other side of that coin, which is that women do spend 25% more of their lifetime in poor health than men. And this is obviously somewhat of a big issue for women, but it is frankly also an issue for all of us in society, and also a big issue for us from an economic perspective. So 50% of the women that are affected by these disease burdens are actually women that are in the workplace. This is not like, sort of these so-called older generations, although I hate that term anyways, but this is women that are, really kind of have an interest to provide for themselves, to provide for their families, and to also kind of, contribute to sort of the economic growth and the GDP of, whatever economy they happen to be in. And what we also know is that in the past 70 years, the GDP growth has largely been driven by the increased participation of women in the labor force. And so, if we take these two data points, on the one hand, we see people kind of taking themselves out of the labor market simply because, there's all these health issues that they can't get care for, and they're just not well enough in order to participate in the job market, the labor force, to their full potential. And on the other hand, we see all this economic growth because of women's participation. So this is a McKinsey slide, and it's like kind of, it was created in collaboration with the World Economic Forum. And so basically what this says is that if we were to really put a focused effort into fixing just the 10 diseases that have the biggest disease burden on women, we would end up with a $1 trillion growth in overall global GDP within the next 14 years. So this is achievable, and we all will potentially see this if we were to only put the effort in. So this is my $1 trillion number, and I think it's a pretty impressive one. So fortunately, what we're also seeing is that the investment community, both the investment community that is sort of concerned with investing in early stage research, but also the investment community that is kind of funding early stage companies, is really starting to pay attention. And we have seen the investment volume in femtech or in women's health innovation overall definitely go up over the past couple of years. Specifically by 14%, as you can see on this slide, when we're comparing the numbers from 2018 to what we're seeing in 2023. There we go. So, we're looking at this slide and we're like, oh, this is great. Femtech is sort of like women's health is sort of on the rise. Things are amazing. And as always, unfortunately, there's more sides to one story. So, of course, this number looks great, 300% plus growth. But what you can also see is, here's the 2018 number, and I'm actually standing in the way. We started from a very, very, sort of small base. So in order to grow by 314%, that sounds great at first. But if we compare the total spend, or not total spend, total investment into women's health to overall healthcare investments, it's still pretty tiny. So we have quite a bit of catching up to do. And so although the number is encouraging, always with a grain of salt. And unfortunately, there's also a second part to that earlier graph, and it's also, sort of a little bit of a, well, depending on whether you're on investment or on the entrepreneur side, it's a little bit of a disappointing one when it comes to valuations. So what we are seeing across the board, whether it's health tech, biopharma, device diagnostics, so it really doesn't matter what sort of, what your product is or what you're building, the valuations in the women's health space tend to be lower. And if you're an investor in the room and you've listened to me talk about the big opportunities and now you're seeing, oh, this is what we call an undervalued asset class, I would be like, yes, I need to invest in women's health. And so, I definitely encourage you to do that. On the other hand, I'm putting on my entrepreneur hat, and I'm like, what this also means is that it's incredibly difficult for early stage companies to raise enough money to actually get a decent evidence-based MVP off the ground that shows both the potential for positive impact on patient outcome and also health economic outcomes. So it means that, and especially in Europe, I will say that, we're really seeing, we hear these exciting stories of a startup that, raised 300K in pre-seed funding or whatever. It's incredibly difficult to really build something of substance if I'm, kind of underfunded from the very start. And I think the valuations that we're seeing at the moment, specific in Europe, unfortunately, I need to say it again, I think it's a problem and it hurts a lot of entrepreneurs. So say I've kind of conquered this, I've raised some funding, I've built my first MVP, I'm completely ready to go to market. Unfortunately, my challenges as a femtech entrepreneur don't end there. So unfortunately, in the women's health space, anything to do with women's bodies is still incredibly stigmatized, and we're seeing a lot of issues, specifically in advertising spaces. So this is a slide that I borrowed from an organization called the Center of Intimacy Justice, which is active globally, but based in the US. And so basically what they did, they surveyed 60 female health companies who are advertising on Meta, so Facebook and Instagram, TikTok, and Google at the moment. And out of 60 companies they spoke to, 100% of them, so all of them, have had their ads rejected for brand safety reasons, and for their ads being too adult. So we're really talking about ads, as you can see on the top, for breastfeeding, for pelvic health, for a bunch of things where you're like, why? And it's an algorithmic injustice and, dare I say, algorithmic censorship. And the thing is, this is not just, oh, they're getting their ad accounts shut. Oh yeah, I also forgot to mention that. 50% of the companies also reported actually having their advertising accounts shut down by Meta. So this is a real issue. And the thing is, it's not just about ads, right? Like that's like where it starts. But what it really impacts is, A, it impacts the ability of companies to actually market to people, to reach the market, to reach women with the information and the solutions that many of them desperately need and are looking for. And the second thing is, it frankly hits the company's bottom line. It's very, very difficult to stay competitive if I'm not able to use the same advertising tools that a lot of other companies, maybe in other spaces, are able to use. So this is a big issue, and I also see it in my own business. So I'll remind you, I run a business-to-business media company that covers the women's health innovation ecosystem. So that means we write a lot about, kind of fundraisers and product launches and company launches and emerging research. And so my advertising network literally told me, well, Catherine, if you really want to make money, you should stop writing about, all these things, because the advertising network thinks you're not brand safe because you mention words like sexual wellness and vaginas and period blood. So, they give you lower RPMs, like what we're paid per impression on the blog. So basically, in very, very blunt terms, and I feel comfortable doing that because in Europe, the Google Exchange server thinks what I'm doing with my B2B media empire is to run a porn site, very, very bluntly said. And obviously I'm not. Given the money that's important, maybe I should, but that's a different story. But yeah, so I kind of, I've come to the point of the presentation where I always feel like, okay, I've been a little bit like negative Nancy now, so, I gotta talk about something that's actually going well in this space. And so fortunately, and I have been following this and writing about this space for the better half of the past decade. And I'm very excited to report that things are actually also going well. There's a lot of things that are encouraging. It's encouraging how far we have come. It's encouraging how far I think we can go, especially given the momentum that's in the market today. But what I will also say is we definitely need more funding in this space in order to turn these things into reality. What you see here is a screenshot that I took from Femtech Insider, the kind of publication I run, just a few days ago when I was preparing for this presentation. And it's like, PMS, menopause, reproductive health access, maternal health, metabolic health. So the future of better health for all is literally being built as we speak, sit, talk, whatever here. And that is incredibly exciting for me and frankly should be very exciting for everybody in the room. But we also need funding. And I have the honor to be in this room with all of you healthcare innovators. So I want to let you go with this one quote from Dr. Jill Biden, who recently was quite instrumental in getting a $100 million women's health research initiative off the ground and was also instrumental in getting a $2 billion executive order to close the gender health gap signed in US Congress. And she said, in a different context, but I'll repeat it here, somewhere in this very room may be the idea that will cure cancer, cure heart disease, cure Alzheimer's. Heart health, brain health, chronic diseases, you, and yes, you, might just have the answers if only we, as a community, manage to dissolve the barriers standing in your way. So today, dear healthcare innovation community in Europe, let's start to do just that and remove some of those barriers and begin with that. Thank you so much.
Thank you, Catherine, on your insights on women's health. Now let's get to know 4 more different companies in our next round of Startup Stories Q&A. This is an exciting opportunity to engage with innovative startups and learn more about their groundbreaking work in the healthcare industry. So let's dive into these insightful discussions and uncover the future of digital healthcare together. Again, the first 2 questions are going to be the same for every industry and every representative. So first, we are introducing Recoc Analytics, represented by Daniel Hugo Heinisch Rodicio. Please welcome. So Daniel, how is your company revolutionizing the current industry?
Yes, thank you very much for the question. So a couple of years back, we had this really important transition in medical records where we transitioned from paper to the electronic clinical record, right? And that was a huge step forward in the information we managed for the patient. So for the patient, that was great. But for the doctor, it was also useful, but nowadays it even adds a lot of work, a lot of overhead, which they need to do to record the data correctly and in orderly fashion, and it's a lot of work. So now what we do with Relisten, our solution, is we try to get that to the 3rd stage, where the clinical health record is actually an additional support and a help for the doctor, and we try to humanize the consultation. How do we do it? Relisten is your little helper during the patient-doctor interaction, which sits there together with you while you talk with the patient face-to-face, no screen, no keyboard needed, and then Relisten transcribes the conversation, it structures it into clinical notes in a really structured fashion, and it enables to trigger additional steps like test request or the electronic recipe. So it saves a lot of time for the doctor, but not only that, it really makes the interaction much closer and nearer as well.
Okay, is there any collaborations within the ecosystem that you'd like to share?
Yes, of course. I'd like to share some collaboration with partners, specifically here in Catalonia. We are working together with TIC Salud and X. We are preparing a POC that will run in different primary care centers to see how really this enables better care, gives the doctor more time to focus on treatment, on adherence during the conversations. So we'll be piloting that, and we also work with other institutions such as Clínica Universitaria Navarra and Ribera Salud, who are helping us really test the solution and bring it to the overall public.
We are used to working with some note-taking applications like those with Teams, for instance. I use it myself in the media sector, or some similar platforms, but why is Relisten the suitable solution for hospitals compared to these alternatives?
Yeah, thank you. I think that's a very valid question. Specifically this week, I don't know if you guys looked at the releases from OpenAI with GPT-4o and with Google, the next Gemini. So these are really generalistic models, and they are really good at a lot of things, but when you turn it down to a specific task, they become somehow unreliable, and they need to be inferred additional information, additional structure, and they need to be trained for a specific task, control hallucinations, and be really specific. So once you try those tools and try to work with them as a general co-pilot, they can work well in your everyday job. But for a healthcare specific job, they simply won't cut the quality needed to really help you move forward. They won't integrate with healthcare systems well. So there's still a lot of room where we, the use case specific startups for healthcare, can add a lot of value that ChatGPT and other note-taking apps can't at the moment.
Thank you, Daniel.
Thank you
for
very much.
sticking to the time also, and good luck.
Thank you.
Now allow me to introduce Horus, represented by Jesus Prada Alonso. I will ask him the following questions. It's Horus or Horus? Horus, okay. Okay, so how is your company revolutionizing?
Yeah, we focus on the creation of artificial intelligence tools for healthcare, in particular machine learning techniques, which is what normally people talk about when they say artificial intelligence. And in particular, what we do is we want to create tools that focus 100% on artificial intelligence, because right now it's a really hot topic. A lot of people are saying that they use artificial intelligence. You see a lot of companies, a lot of research talking about artificial intelligence. But when you see actually what they do inside, sometimes it's analytics, classical statistics, less or more complex, but it's not actually artificial intelligence. We want to focus on artificial intelligence because it's what we are experts on, and we think is where we can add value. And we work in, try to focus on innovation projects, and inside clinical care, inside healthcare, I mean, we focus on clinical care. A lot of companies focus on hospital management, optimization of costs, reducing times, which is sometimes easier to find funds for these projects, but we want to focus on clinical care, supporting the clinician, supporting the patients directly. We decided to create this company because there is a lot of research about the potential usefulness of AI tools in healthcare, but actually nowadays, at least in Spain, in clinical practice, the number of AI-based tools that are being used today is significantly reduced. There is not a lot. So we try to see what were the factors that were leading to this phenomenon and define some company values and work plan to try to overcome them and bridge this digital bridge regarding artificial intelligence, because there is a consensus on the health ecosystem, but we don't have a lot of real examples of AI-based tools on clinical practice.
What collaborations would you highlight?
We are collaborating with several hospitals in Spain, but right now two of the main projects is one with the Hospital Infanta Leonor, where we are creating a tool to diagnose atherosclerosis directly from images, and also with Hospital Miguel Servet in Zaragoza, where we are creating a tool to automatically analyze echocardiograms and estimate some clinical values like the FEBI. But also with private companies inside the digital health ecosystem for sure, but sometimes there are companies that they have their tool, it's a really useful tool, and they want to add artificial intelligence to it, but they don't have the expertise. So they contact us for that. For instance, iFeel, which is a company that gives mental health services, and they wanted to use artificial intelligence to personalize the clinical path of the users, for instance, and we work with them on that. And right now, also with Da Vinci, we are working with public funds from Spain to create a tool for early detection of depression in teenagers, which is a project that I like a lot. I'm highly motivated for that. I think it's important.
What issues in the healthcare sector does your company or your products help to solve, and who are your users and customers?
Artificial intelligence in healthcare can be used for many, many applications and really different applications, but we have detected three main lines of demand for services. The first one is automatic analysis of clinical images and videos. For instance, this project I was talking about, analyzing echocardiograms with Hospital Miguel Servet. Second line will be personal treatment. For instance, we are developing now a tool to estimate what is going to be the response of patients with different oncological treatments. And the third line, for sure, I think you already know about this, is remote monitoring of chronic patients, which is growing a lot. And right now we have, for instance, a tool to monitor chronic heart failures in an automatic way, because it was being done really manual, and the clinicians were losing a lot of time also. And our user, we have collaborations with private companies, as I said before, that want to add artificial intelligence to their already developed tools. But our core, the core of our business is working with clinical institutions, mainly hospitals. And this can be done through purchasing licenses of tools that we have already created, but also creating tools together. We think it's important to collaborate, to create tools together with clinical institutions to solve new problems. So we are totally open to that.
Thank you, Jesus, and good luck.
Thank you for your time.
Thank you.
Bye-bye.
Next, we want to invite to the stage SDH with Vasil Kuchma at the helm. Please welcome.
Thank you.
Vasil, how is your company revolutionizing the industry?
Actually, just to make everything clear, we are not selling any specific product. We're like more digital transfer and agency. We work in B2B with our clients by reshaping the solutions we have. So now just to imagine when by the way, I'm from Ukraine, our company from Ukraine. So in 2016 in our country, we faced, the healthcare system faced the same problems that many countries here in European Union faced. Like we had huge queues in every hospital, we had a lack of specialists everywhere, we had a huge level of bureaucracy. So this reformer implemented e-health system, and we were like at the beginning, one of the first companies there which developed medical information system which was implemented there. So actually we weren't like revolutionary, we were pioneering the market. So we had to develop from the scratch the solution which was never developed in our country, and I believe those years there were a few countries which had this kind of solutions. Did we succeed? Our system reached 16% of Ukrainian healthcare market, and by the way, Ukraine in 2016 was like 42 million population, which more or less compared to Spain. So it was 8 million patients in the system, 2.5 million active patients per month, over 50,000 doctors and physicians in the system, more than 1,000 hospitals working on our system. So it was like cool, pioneering for sure. It's still working. It passed the process of M&A, so now it was sold to a bigger medical information system. By the way, we were the second one in 2020, which was cool. So I can say we're reshaping the market for our clients. We developed, like as example, there were seven different projects included. One of them was like, it's starting from the smallest one, like prescription apps and service which help to so we solved the problem with all the bureaucracy in the healthcare system of Ukraine at the end. Okay. Like that.
What are the collaborations in the ecosystem that you would underline?
Yeah, so the interesting thing, I don't want to say it's like a cooperation, but including a lot of laboratories in our country and research centers gave us access to huge amounts of data in healthcare system, which I can say like a collaboration. And then for now, we're working with one of our solutions. We're partnering with a company in Arabian Emirates, and like we're implementing them in the healthcare system of Arabian Emirates, which is not collaboration with Arabian Emirates, but quite cool as well.
Thank you very much, Basil. Good luck. Thank you. Now we'll share the floor for questions directed to Ephion Health, represented by Enrique Llaudet. Morning and welcome. How is your company revolutionizing today's industry?
Well, we offer a solution to one of the main problems in healthcare, and this is how do we measure the health of patients in an objective and precise manner. And the way we do it is we look at the functional capacity of patients. And by this, we understand the ability to perform tasks of the daily living, like walking, showering, or going up the stairs. Because this is what most matters to all of us, no? To be able to carry a normal life. But also because functional capacity is a key accepted metric to measure disease progression and response to therapy. But the problem is that current methods to measure functional capacity are very subjective and show very little sensitivity to change. And that, as a consequence, makes clinical research and pharmaceutical research very slow, very inefficient. So we offer a solution to this problem with a software a digital platform that allows to capture the data of several wearables that are worn by the patient while performing a short exercise. And then we capture this data with an app, and then we send all this data to our servers where we analyze it with our artificial intelligence, and we obtain several clinically relevant parameters regarding the functional capacity of the patient. But most importantly, we combine them all in a new digital biomarker that allows to quantify in an objective and precise manner the health of the patient.
Like I asked to your previous colleagues, what are the main collaborations within the ecosystem?
We are lucky to have many collaborations at the moment, but the one I would highlight is a very recent agreement, commercial agreement we reached with IQVIA, one of the biggest service providers in the healthcare industry. And according to this agreement, the two companies, IQVIA and Effion, are offering their joint services to pharmaceutical companies to prove the efficacy of new treatments for neuromuscular diseases. So the idea is to perform real-world evidence studies of new drugs for these rare diseases.
Thank you, Enrique, and good luck. Thank you all. Let's thank all the startups for sharing their insights, their knowledge, and innovative work with us today. Your contributions to our discussion are greatly appreciated. This was the second round of the Startup Stories Q&A. There's one left still. Let's go back to more revolutionary alliances, now about customer and centric care, with Stefano De Liguoro from Zurich and Claudia Gomez from Seniors. They will discuss their perspectives on the subject at hand. They will introduce their forward-thinking health insurance plan, prioritizing prevention, this is a key topic today, and customer needs. Furthermore, they'll explore how they use technology to actively safeguard health, shifting the focus from treatment to prevention. So let's dive into this enlightening discussion on the future of healthcare. Please welcome.
Hello, everybody. Do you hear me? Yeah? So thanks a lot to be here today and to listen just to myself, because unfortunately Claudia cannot join. She had a personal issue, and therefore she cannot be here today with us. No? But I try to explain not just the Zurich part, but the entire ecosystem that we have prepared together with them. So what we have launched is a well-being ecosystem. As explained before, this is mainly focused on prevention. You will see it's not a traditional way of doing health insurance, but it's more try to be in the shoes of our customer, of potential patients, and identify how we could embrace and increase their well-being before having any issue. For sure, we have also the insurance part, the insurance cover with the network of doctors and specialists, but the concept that we have created is try to anticipate issue, try to have a better plan for each one of these community, and the one that we will explain today is precisely Vitalidad Plus, that is the senior, the silver economy, and how we can increase, let me say, the well-being of this community that really is one of the main focus from now on. You know that the age is increasing every year, and therefore we have to focus on this community because it's probably the most relevant one in the next following years. So just let me introduce a bit this ecosystem. Zurich Link, born in 2018. This is a pure digital ecosystem from an insurance perspective, where we have introduced all type of insurance that the customer could manage, could contract, manage, and do by themselves, completely alone and without any interaction with any person. So there is a pure device-based insurance. And in this, we have started with device, because this was for targeting, let me say, young people. And then we have increased it because we have seen that not just young people have this need, and to not go to an agent or to a broker, but they want to manage all the insurance in a digital way in their mobile. So we have included new functionality like switch on, switch off of the insurance itself, so the customer can be insured when they want. And one of the main principles, apart from being digital only, is the fact that this is based on prevention as well in all the insurance that we have included. So in e-mobility, for example, or in all the motor household, where the customer can constantly update the insurance based on their needs. And we have done the same for life, for term life. You know that is one of the most important insurance that we have for our future, but also in the health space. So which ones are the, let me say, the 6 concepts that we consider that this health insurance ecosystem have like unique in the market? So the first one is the proactive care. We, for each one of the customer, apart from a pure digital, let me say, onboarding, we create a specific plan for them, because we start with not an AI, but with a real doctor that the customer can choose in the moment of the onboarding. It's a physical one, but they can contact 24/7, okay? So it's somebody that is always there, available for the customer to do prescription, to do first checks, and to anticipate any potential disease or any potential issue that the customer could have. The second one is that this doctor, apart from being reactive, is also proactive and can create a precise plan for each one of the customers based on their needs, on their well-being or their pattern of life, okay? The second one is always the connectivity with the device. So we have connectivity with the smartphone, with the wearable, all the wearable, in order that this information is the uniqueness of this solution that is connected with the medical network. So all the specialists that the customer will visit have the information, the vital information of the customer, and all the potential issues that the customer could have in the past. So it's not like a brand new customer, but all this information has been already sent previously to each one of the specialists. And then, as I say, this community-based solution, no? And I will speak about the Vitalidad Plus just in a bit. So to do this like an insurance company like Zurich, that were not in the health space in the past, we have used the DKV network. So we are there with them, we are our partner, in order to include the capability of the technological part that we bring to the customer, and all, as I've explained until now, with all the patterns that we send to the customer and to the medical network, but also using the proper network, the real network of an expert like DKV in the market, so the customer could go to a specialist in any moment that they need. So essentially, we have let me say, a pure insurance product, complete insurance product. It's not a priceless insurance product with, let me say, the 2 components with hospitalization or without it. But on the other hand, with the digital components of our proposition that allow the customer to do that by their own in any moment with a real doctor available for them 24/7. When we speak about the services, and this is a bit also a claim to all of you that have let me say, a startup or a solution for specific community, this well-being ecosystem, given that we have, let me say, a medical advisory, is to have services and specific companies that are focused on niches, on communities, that could bring specific solution for them. So the first example that we would like to explain today, unfortunately Claudia, that is the founder of Seniors, could not be today here to explain, is to identify these niches, and the first one is precisely seniors, where we could bring to them a specific service that is focused again on prevention. So essentially what we want is a personalized solution for each one of the seniors that onboarding in our platform. What we are doing for them. The first one is to explain them the pattern of a very good quality of life. We listen, so I have listened personally some of this onboarding, And normally the seniors say that they don't sleep well. The majority of them, they don't sleep well. For them, it's normal to sleep 4 or 5 hours per day. That is not normal. It's not the way how to a person should live, no? And the second thing is that they don't do activity. They say, yeah, I walk a lot. Walk is not activity. And therefore, when our specialized coach in the first video call starts explaining to them the quality of life that they could have, none of them believe it. None of them. The fact is that we give them a wearable, we give them the solution of seniors, and after 3 months we identify immediately an increased level of quality of life, and that the subscription that they are doing is really constantly let me say, increasing, because we see that they don't believe, and immediately they use this pattern to live much more let me say, with these new solutions, no? So, the 3 main pillars that we have is the personal coach. This person is constantly contacted with the senior, and this is common for all the community that we have launched. So there is a coach, a real coach that's supporting the customer in all their needs, in nutrition, in activity, in sleep, and in the quality of life in general. Then, let me say that we base everything in prevention, because we try to anticipate potential problems that they have based on these specialists, because we can bring them also to specialists. For example, we are working with AOFI, that is one of the largest community in osteoporosis, for example, and arthrosis, and we bring them in advance, no? And the third one is, apart from the customized plan that you can see there, that we also finalize the value chain. If there is any real issue for these seniors, we have a network of specialists that they could attend and they could do physically. So it's not, the important thing in all of this is that, as you have seen, it's not a pure insurance-based, traditional one. It's focused on prevention, but then always we include the hybridization from a digital to a pure physical solution, because at the end, they are potential patients that we have to treat and we have to manage, no? So this is the way we have done with seniors. Now we have serial customers already there that are combining the solution. Some of them have the health product itself. Some of them have just the service in this ecosystem. And some have both things. The important thing is that also for all the startups is that you could be part of this ecosystem if you have a solution specified for each one of the community that we can include, because at the end, this is not the typical package of the insurance with all the product and service, but is a base usage of the service that the customer can choose based on their needs. So I encourage all of you, all of the startups to participate to this, to contact ourselves in order to see if you would like to be part of this community as well. When we speak about the way how to operate, to work together with us, this is a solution ecosystem that for sure could be done in different ways, in different operating models. The first one is our solution that we have with the direct customer, but also with agents, with brokers, okay, and with all the other institutions. For example, as I said, with AOFI, we are working. So all the association also could work with us. We can integrate our solution in other third-party solutions, apologize, because this could be part of a broader ecosystem or a solution that you have already with our customer, or as we are doing, we are embedded also in the DKV or other association, let me say, solution and way to go to market. So essentially, in my opinion, there is no way of business model that we cannot embrace with this solution. And essentially, our claim is for both, for startup to be part of our community and our solution, and from the other hand, be part of broader solution that you could have in order to integrate this proactive service. I don't want to extend myself too much. I see already Gala say, shut up. And I would like just to thank you all. Here, I'm Stefano De Liguori. You can contact me directly. And we are really here to work together with you. Thanks a lot.
Sorry for the pressure, Stefano. Next, we're ready to welcome representatives from Altaia and Serintia HealthTech. Andrea Esteban and Cesar Rodriguez will be introducing our next segment, Revolutionary Alliances, Bridging the Gap with Technology. Pioneering the new health and social care model, here we will explore SIS Manresa, a home care service seamlessly integrating health and social services. They've developed an innovative management and coordination model supported by proprietary software and cutting-edge technologies like AI. Join us as we uncover how technology is reshaping healthcare delivery, bringing us closer to people and enhancing safety in the comfort of their homes. Please.
Good morning, everyone. Thank you to be here. I'm happy to present today the creation of the Integrated Social and Healthcare Service from Manresa. It was developed by Bartomeu Ayala and Cesar and some companies that are working with us. Yes, the next picture of where we are in central Catalonia. It's a very nice place too, so it's competing with Barcelona. So if you are welcome to join us there. This is the ecosystem that we have developed and working on from several years now about chronicity and dependency of patients. And as you will see, we have worked on many different, not projects, but type of models that we can develop. This is our vision. We know that a lot of people are living in dependency and they are very vulnerable in Catalonia and everywhere in the world. And as well, the information and caregiving environment have to be improved. So there is a social and health factor to be developed and coordinate. And we have to work with all the actors involved that generates impactful knowledge on driving innovation ecosystem on new technology and business model. So what is the problem, the challenge and the mission of our projects? Care providers, hospital and health social care organizations work together to address the problem. And also we have to share information, knowledge, skills, and to develop or to bring effective solutions. The performance that we are looking for, it's a creation of the complete integrated social and healthcare service that we want to provide to patients and also to the populations. So the name of this project is SIS Manresa, and it's already in March ongoing in our zone of region of Central Catalonia. Next. So what kind of added value we want to present with this model? It's an integrated health and social service which has developed a very specific model, a unique one, using technology, digital technology, to improve quality of life at home. So we are already working in the famous hospital at home concept. So we have three parameters that we are working with. It's extension of perimeter, at the service of XPD, it's at home experience patient or hospital at home if you want, with up-to-date technology, on a very specific stage or platform that is giving us all the information that physicians, doctors are really looking at when we just leave, the patients at home or we are working with vulnerable population. So what it is really, what we are giving several solutions, several technical solutions, and you are very welcome to visit us in Manresa and speak with us if you really want to know what we are doing. But we are doing data processing, follow-up on prevention, voice and image recognition, prediction of resources and costs. That is very important today. We are working with Generate that. Virtual assistant in multiple languages, decision making, and of course, automation of tasks. It's done? We are just showing a small video to really explain what it's all about. It's in English or? Yeah. It's everything that, but. Vale. So you can see all the services we are bringing. It's already, as I said, it's not project, it's already technologies that we are using for to keep patients at home on vulnerable population. And this is the kind, of platform that we are using to be sure that we are aware about what is going on and what kind of duties and tasks we can deliver. And we have to focus on, for every patient's room or apartment, we have a single and unique way of getting access with a video to what is going on. And we just, we are giving also 3-day food to give patients, something with flavor where we are putting together a lot of technology. And now I'm giving, the word to Cesar. Okay?
Hello, thank you to Altaya and to Dr. Bartomeu for inviting us to Serintia HealthTech. We are one of the partners that we are working in this project. At the end, what we are allowing is connecting the clinical professionals that are attending the people at home with the professionals that are in the hospital. We are trying to move the knowledge that in most of the cases is only available in the hospital, especially on different specialists that are required in most of the times when the caregivers of the social department, of the healthcare department, it's visiting the patients at home. When they have doubts, most of the times what we are doing, what they are doing, is sending these patients to the hospital, by ambulance or wherever. They are going to be attended on the emergency area, and after most of the cases hospitalized when it's not required. So what we are trying to offer to this system, to the platform, is helping to the caregivers to be connected in real time using augmented reality, sharing all the information that the system is offering, as Bartomeu and Christophe has shown to you, all the patient data, wherever, for taking a proper decision in real time between the professional that is in the hospital, jointly with the caregiver that it's in this moment face by face with the patient, or most of the times with the relatives at home, for avoiding this displacement to the hospital. There's a few results that are showing that in most of the 80% of the cases we are avoiding to move these patients to the hospital. So first, we are improving the quality of life of the patients. Second, we are feeling them more comfortable. They are more trusted on the system, and we are being more effective, reducing the number of hospitalizations or people that are going to be directing to the emergencies area that it's not required. So that's what we are allowing. It's not only a platform for connecting or making a video conference. Obviously, the systems must be secure, must be protecting the data of the patient, and at the end, it's a software that can be deployed in all kinds of environments and can be deployed over other systems that are already right now performing. So what we are trying to do is making easy this collaboration, helping in this case the project for communicating all the rest of the systems that can be used in real time among the caregiver that is at home with the professional that is in the hospital for solving the concrete doubts that they have in each moment, okay? So it's one of the projects it's one of the few projects that we are seeing from a clinical and technological perspective that has been built up from bottom to up. So what it means with that Altai in this case, it's adding different kind of technologies. We are only one of the partners of the whole system that we are aggregating the different capabilities, data collection, connectivity among professionals, hardware requirement or IoT devices at home when it's required, how to share the different clinical knowledge, at the end for offering the required tools for helping the caregivers of the social department or the healthcare department of the Catalonia government for avoiding movements or ambulance using of resources or for reducing the number of emergencies that are attending in this case in Manresa, using all technologies. At the end, the most challenging part of the project is the clinical one that it's where Dr. Bartomeu and all his team it's leading and managing on. So congrats to the team and all to Altaya organization for this project.
Thank you, Cesar.
So thank you. Our next panel discussion is bridging preventive care. So imagine a future where healthcare isn't only focused on treating illnesses, but also to prevent them entirely. We've already talked about prevention, which is absolutely crucial. This transformative approach to preventive care not only prolongs life, but it also enriches it. We're going to explore how to embark on this journey with Rubén González from Segurcaixa Adeslas, Eduard Montfort from Preventia, Gonzalo Santellán from Alliance, Judith Faust from Comunidad DKB, and John Ray, who is going to be moderating the panel. So the set is ready. The floor is yours, guys.
Good afternoon. We're going to be staying with the theme of much of what we've been hearing today from other speakers here, and that is preventive care. So as you can probably tell from my annoying accent, I'm an American, so much of what I bring to this is experience that I've had in the US, but not entirely. And I think it's a universal challenge for all of us too. Much of what we've seen in healthcare, innovation, technology, and other has related to how do we treat people, make them better when they are ill. And the objective really is to try to avoid that from occurring to begin with. So that we have an esteemed panel today who will be discussing a lot of these things. And we'll just jump into it just to go ahead and get started with it. So to level set, we should talk about what are some of the activities that are underway right now by the various stakeholders in the health ecosystem. So Ruben, let me start with you. What do you see happening both in your own organization and in other organizations as it relates to outreach, innovation, to bring about better health for the various patients who we rely on what we do?
So I think that in the health insurance sector, we are living now a change of paradigm. No? We call it the evolution from payer to player. No? From being a mere financial partner that covers your cost when you fall sick, to have a more active role in the healthcare management of our clients. No, if it's a very simple but also a very powerful idea. No, from being just paying your bills when you fall sick to really becoming more active, helping you preserving your health. No? As you say in your vows, no? in sickness and health. And that's a change that is already showing some good indicators in terms of customer satisfaction and especially in terms of customer engagement. Our bet there is our services platform, Adeslas Salud y Bienestar, Adeslas Health and Wellness, that counts with more than 1 million members, active members at the moment, 1.3 million members at the moment. And where we first of all, we ask our clients to fill a health profile, and based on that, we can offer them both content and services adapted to their needs and interests, from healthy habits such as nutrition, physical activity, sleep, tabacism, etc., but also prevention and management of diseases such as cancer with screening services, and also prevention and management of chronic diseases such as diabetes, COPD, cardiovascular diseases, etc. And further than that, we also generate a lot of content, rigorous and quality content validated by healthcare professionals that we deliver in terms of health itineraries to help preventing diseases, webinars, blogs, etc., in order to have a more impactful relationship with our clients, and we reach about 3-4 million impacts every year with our community of clients.
Great, thank you. Judith, same question. What are you seeing both in your organization and in others as it relates to these activities?
So, well, I think as Ruben said, the insurance world has changed towards the, from the payer to player to become a more active part of the patient journey. And this is something that I think it's a must now when the health systems are so overwhelmed with patients. They cannot give health services to everyone at the time that they need it. And that's why now, more than before, maybe prevention is more important. So at the KB specifically, we have a strong focus on prevention and promotion of health, and actually the digital health department that we have in-house was built almost 10 years ago with the main objective to promote this prevention approach and this promotion of health. And we actually built our digital healthy lifestyle index that we have in our app, even before starting with telemedicine services. So there was a strong mindset shift towards this prevention and promotion of health mindset. And right now we are constantly looking for digital solutions from startups, for example, that can help us do this population screening to evaluate our population and find risk segments so that we can intervene earlier and adapt the content and preventive plans for them. And also for those patients that already have a disease, like they maybe had a cardiovascular event. So in that case, secondary prevention, I think it's very important. And we're trying to focus on that to incorporate solutions that can help monitor these patients and prevent complications or exacerbations, for example, in heart failure or COPD, for example.
Okay, thank you. So for both of you, briefly, there's a distinction between efforts that are being made and results that are being achieved. So that's where the KPIs are measured at the end of the day by people who you report to, by your clients and others in the state. What are you seeing, but not just with respect to your own organizations, but generally in terms of results from these efforts? Ruben?
Well, in our case, I may say we have this prevention and health promotion programs where more than we have activated more than 300,000 plans. And what we observe there is higher engagement rates, engagement with the company, higher satisfaction rates as well. And we are trying to measure, and that's a challenge, the health. We observe the health results, but we still have the challenge to measure the economic impact of that health outcomes, let's say.
Good. And anything you'd like to add, Judith?
Yeah, well, I think it's hard sometimes to measure the impact on these. You know, these kind of preventive programs, this is a challenge that we face in terms of, okay, we know that this may work and this may help, but how do we prove that this is working when it's prevention? So it's something that will happen in the future.
It's hard to prove a negative, right? So, yeah.
Yes.
So, okay, thank you for that. So, another thing that's really been of a lot of interest to me is social determinants of health. How do we deal with various segments of the population? Because we're not going to target these activities with respect to only one segment of the socioeconomic status or one age group or anything like that. So, Edward, I'll ask you first. What are you seeing and observing with respect to different ways of approaching everybody, but at the same time taking into account the unique needs and conditions of patients who may be at risk of illness?
Yeah, I think that first of all we have to have a knowledge of the overall context. Non-transmissible diseases have a very high social economic gradient. For example, most of metabolic chronic patients are in vulnerable groups, developing areas. Why is happening that? We are identifying poor diets, less health awareness, and lower infrastructure that maybe doesn't help in physical activity, for example. 70% of population are likely to end up with a metabolic disease during their lifetime. And if we are not going far away, here in Spain, 40% of patients suffering from obesity will end up suffering also from diabetes. And this is costing to the health system an amount of approximately 3,500 euros per year. So at Preventia, we believe that making digital services accessible to everybody, most of the people have access to a computer or to a mobile phone. So it's very important to lower the level to access to this kind of preventive services and to improve digital services for the people.
Great, thank you. Gonzalo, I have the same question for you.
Okay. It's interesting because we talked about ecosystem. We talk about awareness and complexity. And I want to give a different perspective from this. First of all, ecosystem, a health ecosystem means that there is a system that has self-emergent properties. That means that several parts that are related to each other and the relations of these parts have a property. And I always say that emergence is an example of water, and then you will understand what I'm saying in a minute. So one molecule of water doesn't make you wet, but 100 molecules of water makes you wet. So a system relates and has a property, right? And it's good to know that the complexity of that is not a linear thinking. We cannot solve a complex problem just by a linear thinking. It requires very, multiple different points of view in such a complex thing, which is health and prevention. So if we forget this perspective, we just get biased by looking into the system in one part. We forget about other parts. I think it is so important to take into account that the inequalities that we have today in society are very much embedded in the culture. And if you're trying to change a system by not looking into the culture itself, it won't change, right? And if you think about the perspective of Sustainable Development Goals, which is the goals we want to reach in 2030, to have more equity, more, more resources, more health, how can we achieve them if we cannot acknowledge the fact that we're all different? There are different cultures. The understanding of the body, the mind, and health changes across cultures, across language. The way that I create my narrative about health changes, right, in every culture. If we don't understand that diversity, we won't be able to make a change in the world. So we may be able to bring prevention. So it requires a lot of perspective taking into saying, oh, this is complex. We haven't got the solution right now. We have different perspectives. It seems to be linear. So in coming to the question and more how to build equity is taking the diversity of everyone, and everyone has a different concept about health and awareness about that, teaching or showing tools to communities and peoples to know, oh, what do I need to do in order to be in a good health? That is the mindset shift that will create a healthier society.
Socioeconomic status can have a lot of other effects too on people's ability to manage their wellness, relating to technology access, relating to transportation, relating to nutritious food. If you live in a food desert, it's very difficult to get fresh food to keep you healthy. It's a difficult, I haven't seen anybody solve that at this point right now, but any further observations on those challenges? Because oftentimes those are the people who really need the most outreach and where there's the greatest level of difficulty.
Yep. Absolutely agree. Yep.
All right. Okay. We acknowledge the problem.
It is indeed.
Yeah. Okay. Let's talk about patient compliance adherence to protocols too. So something I think we see in other settings is really sophisticated solutions that encourage people to engage in their health. But that requires active participation by the patient, potential patient in some cases. And if the person is saying, I feel fine, why are you bothering me? Or if they've been notified, made aware of an at-risk kind of a situation, they may be reluctant or otherwise not be in a position to comply with the advice, to adhere to the advice they're getting. So Judith, I'd really be interested in your thoughts on this too, what you're experiencing in the marketplace right now.
So, well, I think that patient adherence to digital health tools is an issue in the industry in general, but specifically for prevention solutions, because most of these people are still healthy, so how do you encourage them to really comply with these solutions and take the advice? So for us, well, we know that putting the patient and the person in the center when you create these solutions is key. And well, this is something that we hear everywhere, right? Putting the patient in the center. And at DKB, we try to do that with our community. We call it the DKB Friends community. So we build our own community of citizens, patients, and healthcare professionals. We have almost 380 people already in the community, and we try to use them in order to validate the solutions that we want to implement in our ecosystem, and also to test if the the flow that we have in our mind, to include this solution in our ecosystem makes sense for the patient and also the solution itself. So we try to approach it this way, but still I think that encouraging patients in preventative plans is hard. And I think another way to try to encourage them to use it is to incorporate a human touch in some sense. So not only the digital solution, but also a human coach that can help them, in the journey, and so that they don't feel alone, and that this coach can help them build up their motivation to keep healthy. And I think that, I guess another thing to mention here is that when talking about prevention, I think I would rather focus on the secondary prevention that I mentioned before. So these people that maybe had an initial cardiovascular event, they are more aware that they have a health issue. And the impact that you can have there in order to prevent a complication or an exacerbation in the future, I think is higher than the one that you can have for people that are still healthy. They are not aware of, the problems that they may have in the future. So I would say that, well, from my perspective, focusing on these patients that already had an issue is key to, you will have a higher motivation and engagement in the group, for sure.
Terrific. We're fortunate that we do have a doctor on our panel. So Gonzalo, someone who deals and has dealt over the years with patients in these kinds of conditions, I'd be interested in hearing both from your own experience and your own observations about how do you encourage and motivate people to be more compliant with the advice they're getting to prevent serious conditions from developing?
This is such an interesting question, and I've seen over and over patients coming over and to my consultations and telling me they have all these problems in their lives and all these things, and I realized over the time, and then in the study of adult development psychology and positive psychology, that it comes to the essence of not being connected with their own bodies and what's happening to them, and not being aware that the body that they have is the way they treat the body and the way they relate to it has a major impact in their health. So there's no correlation with what's happening to them now and the impact of the behaviors and decision making in the future. And that's because there's no awareness on them. How do you build up awareness? It's not that I have to impose person, right? I have to coach patients to tell them that their responsibility of their own actions have a direct impact, right? But it takes time. Right. It takes time. It takes me 1 hour to get that. I used to have 7 minutes to see a patient. How do you do it? And there are ways to, we talked about how to measure this well-being investment, and I think there are ways to measure that. There are many, right now, studies that show that the investment on well-being will have a direct impact on the awareness of patients, etc., and how they feel about themselves in the body and how healthy they feel, which is a perception. But I think we have a tremendous problem right now that people are completely disconnected with their health. They're not taking responsibility, and they come to a doctor to give them pills to cover the symptoms and not to treat the problem, which is awful, to be honest.
Yeah, so you've hit on something I think is really important here, and that is the overwhelming reliance we have on the doctors to do these things. So Edward, I'm going to turn to you and talk about potential technical innovations that could come into play, because we can't ask people like Gonzalo to spend that hour every time when there's a waiting room full of patients waiting to see him.
Well, I think there are 4 key points talking of innovation. The first and most important one is the accessibility and cost efficiency. We are able to create digital services with a low level of resources, and all efforts should be put in creating these digital services that creates a facility for the patients. Also, I think it's very, very, very important to focus on hyper-personalization. So we are seeing a big amount of data for every user. We have wearables, we have medical devices. They are all connected, and we can make use of this amount of data to create this personalization needed for the patient to understand and to be more motivated to take action in their prevention. Also, I think AI will change how we see prevention and how we innovate. we should take part of technologies such as predictions that will help us acknowledge early with early detection of diseases, and this will help to motivate users also to know their health status and to take action as soon as possible. So I think that technology will help us improve how patients see their health status and the possibilities it offers to improve, not waiting for the disease to happen, but anticipating to it.
Good. So, Ruben, as someone who is largely reliant on others, whether it's your contracted network of clinicians or technology partners or whomever it may be, how do you view the emergence or absence of emergence in technology to achieve some of the things you discussed earlier about what you're looking to accomplish?
Well, I think digital health and technology is a game changer, and it's a key success factor for our prevention strategies. I think it has three main pillars that helps us drive those strategies, and Edward mentioned some of them. First of all, the personalization or hyper-personalization, no? To be able to gather information in the health profile, in the risk assessments that we perform, in the activity that we gather and that we process, that allows us to target services and content to our customers based on their needs, based on their interests, and also based on their motivation, which is very important to what we said before, no? In order to drive something that really makes behavioral changes in the patients or in the population. Second, I would say scalability. For us, for such big company as we are, scalability is key. No? It's difficult to move the needle, no? And to get the returns on the investments done. And technology helps us to go to a wider population across different geographies in an efficient, cost-effective, and controlled manner. And the third one, I would say innovation, and specifically here. No? You guys are addressing some of our clients' and patients' major challenges, and we really trust in an open innovation model where we can embed those solutions that are already showing clinical outcomes, that are already showing cost efficiency, that are already showing customer satisfaction, and do a partnerships with you and with our clients to get a win-win-win strategy.
Yeah, so that's good. So you're talking about some of the things that you're doing now with technology. There's always the other side of this, and saying that what you want that's not yet either deployed or available for you. If you had to think about or describe one technological advance that would really enable what you want to do that's not happening today, does anything come to mind? And Judith, I'll ask you the same question.
I go first?
Go for it.
Okay, well, so there are so many things that we can do, right? So we are trying to prioritize what may have a higher impact. And just to give you an example, well, as you were asking, right now for us the cardiovascular area is key because it's so prevalent, and well, it's the major cause of death globally, and Spain also. So we are now, for example, working in a European public project called Predetect. So this project is led by a startup that created this technology where they can analyze voice recordings of patients with heart failure and identify a complication or prevent hospitalizations, because they identify this patient will have a complication 20 days before it actually happens. So you're still on time to do something about it. And that's a project that we're working in because we believe that it can bring a strong value for this particular population and try to link this with preventive plans for these specific patients that, that are detected to possibly have hospitalization in a month or so.
So artificial intelligence, as you look into the future about further evolution of capabilities with AI, in fact, this is such an interesting topic. I'm going to ask each of the four of you to comment on this too, about how, I think it's fair to say we're at the early infant stages of deploying all of the capabilities of AI that we're going to see. So Gonzalo, I can see your jump.
Yeah, I want to say something because we're talking about AI and prevention, and we forget that we're talking about humans that have feelings, emotions, and AI doesn't have feelings and emotions. So it's good to know that we're talking about people that have feelings, emotions, that have problems in their life. They are stressed, and I think it's great to have AI, and it's going to help us in so many ways but the change won't come from AI. The change comes through the inner transformation of the people, the way that we create a society that's more sustainable. And we haven't mentioned about what is expected in 10 years from now to be the cause of highest comorbidity and people not to go to work, which is mental health. Yeah. By 2020, but in 7 years, the WHO, the World Health Organization, predicted that this is going to be the most important cause of disease, comorbidity, and not going to work. And so I think, what is that? What is mental health? Are we talking about the mind? Are we talking about humans' feelings? Are we creating a culture of people, communities that are not informed about it? And then later, it's going to impact in everywhere we go. So I really like the topic AI, but I want to be just be the backup right now and say, don't forget we are humans and we have feelings and there are problems that we need to address into that point. Yeah.
That's a very good point, and I love the notion of the importance of mental health in the mix and all this, and you mentioned the comorbidities too, because rarely do you see a mental health issue that's not accompanied by some other physical issues? Edward, do you have any thoughts on the AI, where it is today, where it's going to go in the future as it relates to preventive care?
I think that the main point will be in predictive services. The early detection will be key on making people more awareness of what they have on their future, to understand their health. Also, I would like to point that AI will help in education. For example, we are seeing large language models that most of people, for example, don't understand quite well medical tests, for example, and these technologies will help understand. You can talk with your medical test, you can talk with your latest analysis, and this will help to understand where are you and where are you going, so later on you can take the correct actions.
Ruben, thoughts?
Regarding artificial intelligence, well, I think it's a tool at the moment. I think it's we have to be very aware that at the moment we have a system that is still based on the patient and the healthcare professionals. And I think that it's a tool that can make those professionals more efficient and effective in the way they take decisions for their patients. And in terms of prevention, I think it also has the capability of processing huge amounts of information and helping the organization and the patients identifying those risks that may lead to develop a disease, for example.
And like I said, I'm going to ask all four of you the same question. So Judith, I'd be interested in your observations too, and especially if there's anything that you're seeing actually in practice right now as it relates to the AI applications that are being deployed and potentially making an impact.
Well, I think there are so many applications on AI and so much happening at the moment that you know, obviously, just to pick one. Yeah, I don't know, another example, like just to put a real example of something that we also want to work on is using AI, always connected with the healthcare professional and the human touch, because obviously we are humans and we don't have to lose that, you know. But for people actually in mental health, people with depression, there are so many people with depression or different anxiety disorders. And obviously the healthcare professionals can help, but we don't have infinite resources for that. And AI, I think it can help identify those patients that may need a visit before another one, you know, just to do this intelligent patient triage so that the patient that needs the help now gets the visit earlier than the patient that maybe, you know, okay at the moment. So I think that AI can also help optimize and make the health system more efficient in that sense. And at the end of the day, it's also, it's gonna reflect on the patient outcomes in the end, obviously. So.
You hit on something that's near and dear to my heart too, and that is the efficiency aspect of what we're dealing with globally. The shortage of personnel, trained clinical personnel such as registered nurses is acute and getting worse, adding more and more to the cost, overall cost of delivering care. So do you, and Gonzalo, as our sole physician on the panel, I'm going to come to you on this as well, the ability to enhance efficiency and productivity for medical professionals, physicians, nurses, and others who would benefit by the intervention of AI tools in advance of the actual visit with the clinician.
Wow, what a question, huh? You dropped the mic there. What a question. This is interesting. I think you can have all the data presented onto you, and which is wonderful, and you have all the history of a patient, and then you have the patient in front of you. But if you are not there present with your patient and you cannot process the data and adapt it to the patient, the data doesn't work. Yeah, we have tons of information, but what does it happen really with the patient when you have that, you know, that someone is asking for help? So I would say, yes, I love AI. I think it's great potential to discover and trademark all the things that danger. But I wonder if my solo intervention is say, have AI, but then teach doctors and nurses to be more present with the patient so they can hear between the lines and they can detect as if they were AI, what are the little things that they can do? Oh, I see a risk here. I think it's a good time for intervention. So being more present with yourself and with the patient, and then using data as a consequence. That will be my intervention, of course.
So we could easily continue for another 30 minutes, but we can't. We're out of time. So I want to thank all four of the panelists. It's been very productive. I think we have far more answers than we did at the beginning of our conversation. Thank you all.
Thank you.
Okay.
Thank you for sticking to the time, John. Now the next topic is about, again, revolutionary alliances, but now we are going to learn from digital health. Are you ready to gain valuable insights into the world of digital health? Let's uncover groundbreaking collaborations and innovative approaches shaping the future of healthcare. Please give a warm welcome to Ali Parsa from Babylon and Aline Noizet from Digital Health Connector to share their expertise.
Good morning, everybody. It's a pleasure to be here today and to have Ali Parsa with us. Pleasure and an honor. So for those of you who don't know Ali is a serial health-tech entrepreneur, healthcare entrepreneur. He was the CEO and founder of Circle, healthcare provider, private healthcare provider in the UK, and also the CEO and founder of Babylon. And for those of you who don't know, Ali recently moved to Barcelona, and he specifically chose Barcelona to start his new healthcare venture. So Ali, why is it a good time to be in healthcare, and what makes you feel good about being an entrepreneur again in healthcare?
Aline, thank you very much. I was thinking that you may ask me why I chose Barcelona, and the answer is because of the weather. Global warming is making London too hot and too sunny, and I needed some rain. So we came back to Barcelona. Look, I think we all have been talking recently about the advent of artificial intelligence, and we are all super excited about it, and we should be. But actually, if you go a layer below that and look at the science and the development in science that are happening today, and not just what is in the laboratory, but what is being created, what you're seeing, let's just take 5 or 6 things. One, you're seeing the advent of quantum computing. Quantum computers that are in existence today and stable and not in use yet, but in existence, are 100 million-fold, 100 million-fold faster than the fastest supercomputer we have in existence. Imagine what we could do with artificial intelligence when we can process them on these quantum computers versus the existing GPUs we have. My friend Demis Hassabis once said that if you take, it doesn't matter whether we solve quantum computing problems first or general artificial intelligence problems first, whichever we do will help us solve the other one super quickly. Second, we are now be able to connect with that supercomputing power, much faster than we could before. I am a generation that remembers 3G. Then we came with 4G, 10 times faster, but then we came with 5G, which is 100-fold faster than the 4G, and that is now almost becoming ubiquitous, and we are now almost on the threshold to come with 6G. That will be super fast. So we will have the kind of fiber optics that we have at a gigabyte per second available on our mobile phones. Thirdly, we are now going from connectivity of data at only about 20 billion devices to about 1 trillion. But more importantly, for those of you who's watched the recent announcements by OpenAI and Google the next day, we've now turned our mobile phones into data collection by visually looking at something and being able to collect and inform that. Fifth, we're coming with we're replacing predictive analytics with prescriptive analytics. So not only in AI, we can now tell you what is going to happen, but how is it going to happen? When is it going to happen? For what reasons is going to happen? And then next, we are now going away from this boring looking at our two-dimensional phones to our ability to integrate with virtual care in our virtual things in our virtual reality and augmented reality, and then finally, we're bringing it to the physical world, robotics. Just think about each one of those things and what they can do in the world of technology versus where we are today. I just can't think of a more exciting time, Aline, to build this company. None of these events are going to have an effect in healthcare just because they are there. They're going to have effect in healthcare because brilliant entrepreneurs that we heard this morning across these stages are going to, and the next generation are going to come and do something. So my only word of encouragement to my fellow entrepreneurs is that do not think about a small problem that you can solve today with the technology that was of yesterday, but take a big problem that you can solve with tomorrow's technology and solve it now. We all are in envy of OpenAI and the amazing work it's done, but we forget that it took it almost 10 years and billions of dollars before they even came up with ChatGPT-3. We can do that in Europe. We just need to have the courage, the money. So my thing to my fellow investors also is that think of the big prize rather than the little crowns.
Amazing. Ali, I think those are amazing, exciting reasons to be active. And I like the takeaways for the entrepreneurs, no? Look at big problems. And I would like to go back to what I was mentioning before. You're a seasoned and serial entrepreneurs. You're a reference for many, for what you did with Circle, Babylon, etc. And what are the learnings that you got out of those years? Like, maybe that's a big question. So maybe let's split it into, if you give us three arguments around operational learnings that you got from those years involving those different ventures.
Yes, so I used to be 2 meters tall, blue eyes and blonde hair before I started. How much we all learn every day in our lives is endless. But it's a good question to try to limit operationally to 3. Maybe the 3 things I will start with, first and foremost, is focus. I just talked about all the things that can be done, all the technologies that exist, but no one-person organization can do all of it. The question is, which is the one thing that we're going to pick up and become incredibly good at? Like Google decided DeepMind to do that at general intelligence, artificial intelligence. Somebody else is doing it in something else. So trying to do it for everything. And in healthcare, it's very easy to try to do it for everything because the entire system is almost broken. So if you touch something, you want to solve everything. But that focus, I think, matters. Secondly, I think there is no replacement for a great product and a great team behind it. You all remember the book Blitzscaling, for instance. And it argued that if you are growing super fast, it doesn't really matter who you hire. Just put any bum on any seat and grow. I have, honestly, bad advice. Leave that seat empty, but just have the best people you can find and don't do it until you can't. So amazing product and amazing team needs to follow that focus. And the third thing, I think, is governance and control. Look, it takes a huge amount of time to build an amazing business. You need fellow travelers from your investors to your employees who share that vision and value that follow you through that time. And you need to have control over that journey because the journey is going to go up and down a lot. And your investors may have fundamentally different interests than your journey because, not because they're bad, because they have other pressures on them. They have to return the fund, they have to balance it against their other portfolio things, very reasonable, rational things they need to do, but that may not be in line with what you need to do to bring home your journey. So I think the 3 things I learned is super focus, super focus on having the best product and the best team, and then making sure you're set up from a governance point of view over a long term to deliver that thing, because the moment you lose that control, you may lose the whole dream.
And so you were talking about investment just now. We have many entrepreneurs in the room who are trying to raise some money. And you and Babylon are still known as the company in Europe, digital health startups, that raise the most money, 500 million. So do you have some tips for those entrepreneurs who are trying to raise? Maybe what should they do in the deck or when they approach investors, when to approach investors, like concrete tips for them?
I don't know if I'm qualified enough to give tips, but I would be happy personally to talk to any entrepreneur at any time, because each person's story is different and what they need to raise is different. So reach out and we'll have a private conversation. But generally, I tell you, I find most investors want to invest. They're not there to waste their own time. The question is, does it meet their criteria and what you need to do? And do you have a good business? So I think if you have picked out a very big problem and you're trying to solve that problem, and the rewards are going to be there, and you have a great team, and you have the right governance, that you got the operational right, then you need to get the financials right. So I think that, again, going back to your previous question on lessons, I think that as an entrepreneur, it doesn't matter how much money people throw at you, and I made that mistake too, right?
Doesn't matter. You need to focus incredibly hard on your costs, right? Be unbelievably frugal and demonstrate that you are. Second, you need to get the business model right. I see a lot of businesses that don't get funded, partly because the business model either doesn't have revenue leverage, or it doesn't have gross margin leverage, or it doesn't have operating leverage. You need to get all those three leverages right. If you're selling a pair of jeans that is costing you $10, at $9, you will never make money. If you're selling it at $2, you're in a damn good position to make money. If every pair of jeans you need to sell is going to cost you $5 in sales, in operating costs, you're never going to make money. So getting the fundamentals of finance right, it's super important. And the third is, you know, if you got your operating model right, you got your business model right, by the way, you also need to get your cash engine right, right? I mean, you can have all the right margins, all this, that, the other, but if you don't get paid in the right way that generates cash, that's a problem. Everybody talked about Amazon having 2, 3, 4, 5% margins. Nonsense. Amazon gets its money today, and it pays its merchants 9 months from now. That is billions of dollars of cash that sits in Amazon's accounts any time of the day. And as long as that business is growing, it's almost like doesn't matter what happens to that thing. So I think maths matters, and I think being able to get that thing right matters. Having said all of that, look, raising money is never easy. But I don't think you should ever think about how much I raise. You should think about how do I build the most useful, brilliant business in the world and hope that other people find you. I can, in all honesty, tell you that almost in all our fundraisings, we were always approached by others rather than go and chase them, with the exception of once or twice in our history. Because good people find good people to invest in.
Yeah, exactly. And maybe just short focus on scalability. So when you build a company is going well, you want to scale, you're going to go to other countries. Do you have some advice on that?
Again, Aline, I think that is so specific to each country and each place and each problem. Again, I'd be super happy to talk to each entrepreneur in this. But you're absolutely, there is a huge gap between, I've run businesses of 10 people, 100 people, 1,000 people, almost thousands of people. And I tell you, at every stage is super different what you need to do in order to get there. And one of the problems we have is that often the executive, your executive, I don't think they should, by the way, change entrepreneurs, and I tell you why. Because that drive that gets you from 0 to 1 is the drive that gets you from 1 to 10 and the drive that gets you from 10 to 100. But the team, the executive team that got you from 0 to 1 to 1 to 10 to 100 to the 1,000 may be very different. So you need to be able to change your team. I'm an avid football supporter, and I watch teams that go from one league to another and they change 90% of their teams. And you kind of almost need to do that sometimes with your thing. What I found is most of your team grow with your growth, but some don't, and you need to be able to manage that. Each of your questions, Aline, are big, right? I mean, they are big questions. We have 15 minutes, and one of the things I learned in life is never go over time. I'm looking at our time, and we got 1 more minute almost left. So I just encourage people to just come and talk to me. I mean, I have never had an entrepreneur in my life knocking on my door that I didn't sit and talk with them.
That's fantastic. And I think we're very lucky to have you here now in Barcelona.
I'm super lucky to be here. But look, let's just finish with this. This is an incredible time. We talked about the events in technology, but if they say software was going to eat the world, biology, in my view, is going to eat software. If you look at the advance in biology now, we've now created just synthetic biology, because we can't talk about all of it. We've created a rat that can sing like a bird because we injected its throat with the bird cells. We created a mice that is 6 times more intelligent. We created a worm that can live 10 times longer. We've created a tomato that does not age. And we reversed aging process in 2 twin mice, one aged and one stayed young. You just think about what biology is going to do eventually to our life. We talked about technology. This is an incredible, incredible time to be an entrepreneur. It's an incredible time to be an investor. And all I think we should all think about is dream big, build fast because life is short, and then be brilliant in whatever you do. Everything else will follow.
I think that's a great way to conclude. So Ali, thank you so much for being here. We wish you all the best with your new venture. And we're very excited to have you here in the local ecosystem. And we also hope that we can collaborate together and help you on that new journey.
Very much looking forward to it. Thank you.
Thank you, Ali and Aline. Let's turn now into evolutionary alliances where computer vision and artificial intelligence converge to transform rehabilitation. We'll hear perspectives from Andreu Casadellà from Improfit and Lluís Guirao from Mútua de Terrassa. They will provide 3 illustrative examples showcasing the power of AI in diagnosing and monitoring patients. Please give a welcome to them.
Okay, sorry. So, good morning, everyone. Lluís Guirao will stay here afterwards for questions. What I will present today are some cases that we have done through computer vision with patients, and there are 2 exercises that we have digitalized. First of all, let's start. What is computer vision? Computer vision is part of the AI, and we digitalize pose of the body, human pose estimation. We mix that with augmented reality. Augmented reality, we put some objects in the screen, and you are between both worlds. We have done some things like you can see here with the hands for stroke disease, and we digitalize all movements. So the cases that I will show you now are, we have checked which exercise are done in which protocol for stroke disease, 9-peg hold and box and blocks. These are exercises that are done when somebody has to do neurorehabilitation, but first of all, we have to decide which part or how is this disease. So, if you check in internet box and blocks, in 1 minute, you have to put different objects, physical objects, and you calculate how many objects you put that. So we have digitalized that. This is a patient with the problems in the hand. And for example, in this case, normally you have 10 or 15 balls for each movement. And 9-peg hole, you have to put, there are 9 holes, and you have, it's like what our kids do when they are young or kids. So you have to move them on the screen. In this case, Dr. Guirao, first of all, we do a diagnosis. So how are my hands? Can I open? And you will hear now.
Hold on. Open your thumb and index fingers. Close your thumb and index fingers. Open your thumb and index fingers. Close your thumb and index fingers. Hand completed.
So now we will change the hand, and we will understand with both hands which is the position of the thumb and index finger. And the balls will move according to that. These are the real exercise digitalized of the box and blocks in this case. So we have to move in 1 minute. There is the inference of the hand, and we have to take the ball and move to the other place. If you cross in the middle, it's not allowed. So it's like the real game. You will see now in the example that he will try to move, and it doesn't work. And in the other exercise, you will see the 9-peg hole also digitalized. In this case, you have to take the balls just with a camera of your laptop or computer, and we know how many balls you put in 1 minute. So we have done this test with 15 people because we want to make sure that it works. And this is, for example, our analysis for the exercise with the thumb and index finger. And we have seen that it's over, the P is over 0.05. What does it mean? It doesn't mean that we have different results, but we have done that with 15 people in both hands, so 30 hands. And same thing for the box and blocks and 9-peg hole. And what we see is that, there is no deviation. It's an exercise, once you do the first 30 seconds, then you improve quicker. And the second time you do it, also, you improve that. Now we are testing that with some patients. Those patients had stroke disease. We are doing that as a test just to make sure that the patient, that this exercise is working. Why? Because it's much more scalable. Our focus is to do it in the hospitals or rehabilitation centers, and afterwards to reinforce that at home. Because as you know, the sanitary system is a bit collapsed, and this can help a lot. All the experience of the users are very, very good. Why? Because it's a kind of gamification. First of all, you have more adherence in the rehabilitation. And more important, the doctor can check the evolution. And you can see in the next 3 months how is your exercise. And we have digitalized something that is done in the real world. So we don't want to invent new tests. We do what we know that work. So which are the conclusions of that? Our conclusions, it takes a couple of seconds to pass. Okay, so for the open, first you need the initial picture. Okay, which is Andrew had a situation in his hand. How is he today? So my picture is that now I can do it 3 centimeters when I open and 1 centimeter when I close. Afterwards, I try the box and blocks and then I pen hold. So the first check is really important, the control phase. So the augmented reality helps to do it easier because we are doing also some things with skeleton, with all the skeleton, but we try to mix that because it's easier for playing. So that's it for now. These are our emails. If you have any questions, we have a booth here very close. The company is in profit. And we have also, you can see us because we have a screen of a software that we made for Technogym, the rehabilitation and fitness company. Thank you very much and enjoy your day.
That pushes the boundaries of AI in healthcare. Let's pioneer the DX-GPT model, exploring its potential to revolutionize healthcare through generative artificial intelligence. Please welcome Julián Isla from Microsoft and Fundació 29 and Susana Boronat from Hospital de Sant Pau as they join us to provide us with their expertise. Please welcome.
Good morning, almost close to afternoon. I'm the only one between you and lunch, so I will try to be sharp and interesting. The original invitation was for a 1-hour presentation. I realized today is 10 minutes, so I will try to speed up and try to make the keynote interesting for you. My name is Julián Isla. I'm the founder of Foundation 29. I have multiple roles. I work for Microsoft as well, and the more interesting thing is I'm a regulator. I'm a member of the Orphan Drug Committee of the European Medicine Agency, and for sure, the opinions of that session are my own opinions, and they are not the opinions of the agency. I don't have any conflict of interest in terms of financial relationship with the industry. This is my son. I'm the father of Sergio. Sergio is a child with a rare disease. The name of the rare disease is Dravet syndrome. It's a neurological condition, and it's a severe and complicated condition. The main problem are seizures. Sergio had a lot of seizures. They started when he was 3 months old, and he had around 2,000 seizures during the last 15 years. It's a complicated condition. Because of this, I started to be involved with patient organizations. I founded the Dravet Syndrome Foundation in Spain, the European Federation in Europe. But the first problem, and this is one real picture in one admission in one hospital, is the problem of diagnosis. Because at that moment, Sergio was in ICU. And when I was talking to the neurologist, do you have any tool or something to understand what's happening to my son and what's the diagnosis? He told me, no. And the lack of this tool has been running in my brain the last 15 years. The thing is, this is the chart I use in order to track all the seizures that Sergio had during the last 15 years. And you can see the condition is stable, but he has a big peak at the beginning because we put Sergio in a bad treatment. We put Sergio in a drug contraindicated for Dravet syndrome, and this raised the number of seizures because the lack of diagnosis. And this is the problem. When I'm a software engineer. I'm not a medical doctor, and I don't have medical background. But when you are coming with an engineer background into the medical field, you are scared because the medical activities in most of the cases are really, really unpredictable, especially with the lack of tools. Because of this situation, 6 years ago, I founded Foundation 29, which is a non-profit organization trying to use technology to improve life of people living with rare diagnosis. And I have a video who explains better what we do than me.
Sergio, like other children with rare diseases, is a child who needs 24/7 support. When Sergio had the first seizure, we didn't know what happened. We ran into the emergency room. We ran into a lot of testings. We spent a lot of time, a lot of money visiting specialists, because when you don't know what's happened to you or your family, you try to find an answer. We spent 6 months until having the final diagnosis. The problem of this gap for the proper diagnosis is that we put Sergio in a bad treatment for Dravet. One day he had 20 seizures. We just stopped counting. Statistics say that the average patient with rare disease, they need to visit 7 specialists until having diagnosis, and the average time to diagnosis is 5 years. Diagnosis is important, not just for treatment, but also to find a group, find a community, a place where you can share your pain, share your problems, and get answers. The Global Commission is a global initiative. The ultimate goal is to create recommendations to try to improve the time to diagnosis. When the Commission was founded, I talked to the representatives on this global initiative and I asked them to be involved. I created this non-profit organization, Foundation 29, with the focus of using technology to improve the life of people with rare diseases. When you have a child with a rare disease, and because your life is going to change, the company you work with is very important. I feel lucky because I've been working in Microsoft for 20 years. Microsoft has a lot of flexibility to allow people with a particular problem to focus on what is important to them. We won't be able to find a treatment for Sergio, and we won't be able to make Sergio will be healthy and normal, but our energy and the work we are doing in our family is focused in order to avoid the situation for other children. If we are able to help other children and we are able to diagnose these children early and avoid the same situation that we have for Sergio, this will be great because our life will have a purpose. We won't be able to make Sergio healthy, but Sergio in some way will be able to help so many people. This is our motivation.
Well, with this motivation, we created this tool. It's called the X29. It took to us 4 years to create the tool. It's a clinical grade tool. The doctors are able to use it. We created also a version for patients, but the idea is that patients and doctors should go together looking for diagnosis. And the tool is available right there. You can use it and put a medical test, and the tool is able to analyze the clinical records from the patient. It's also able to analyze the genome or any kind of NGS information from the patient and provide a list of conditions for differential diagnosis. The thing is, after this project, we have 4 takeaways. Training data. There is a big lack of training data in healthcare. It's not easy to have training data. We didn't find it properly, so we have to use algorithms and training models for the research world. The doctors, they don't have time. Most of the users we have, they are doctors using the tool at night from home, after all the hours in the hospital. The models to modulate the diseases, they are limited as well. And also in healthcare, there is strong competition between different groups, creating ontologies and very complex discussions. And it took to us 3-4 years of development. This is a lot of time, you know. But something happened in November 2022. In that moment, you know, I remember myself in front of ChatGPT saying, oh my God, this is really good. This is something new. And it was new. And for me, it's the difference between the past and the future, totally. Because when that happened, and this is the reason you guys can see this big hype with LLMs, a large language model, we did this experiment. This experiment is the same tool that took to us 4 years for develop that tool. We did this in 3 days, from 3 years to 3 days. Why? Because the model behind the tool is GPT-4. We changed totally the tool, and we are taking the initial description of the patient. This is the description of my son, by the way, and we are prompting the description of the patient and sending the call to the GPT-4 model in order to get answers. And we are asking for a list of potential conditions. And when you have this, on top of the description of the condition, you can also ask for more symptoms. You can also ask for the diagnosis process. You can talk to the model and ask for the rationale, the medical rationale behind the list of the conditions. Super powerful, super powerful. And the thing is, because of the prototype, because we prototyped this in a very fast way, the regional health service in Madrid realized the potential of this, and they proposed to us, okay, are you interested to explore if we can use this in primary care in all the Madrid area? So, yes, why not? The tool is already there. We didn't test it in a clinical environment, but we have real signals that this will be valuable. And they told us, okay, let's explore with the physicians if they find value with this, because at the end, it's not a medical device. The tool is not providing diagnosis and the patient will have a prescription and a drug. No, no, no. It's just to facilitate the process of the physician. So we created this small tool just for the SERMAS, the Madrid Regional Health Service in Spain, and we integrated the tool into the HIS they use in primary care. It's APE Madrid. In APE Madrid, the doctors in Madrid, they have the possibility to open a diagnosis process for a particular patient, and when they click on this, our tool is popping up. They put the symptoms, the description of the patient, and the tool is opening a full process in order to, if there are signals of a rare disease, send the patient to secondary care or in a hospital for the final diagnosis. The thing is, the feedback has been very good. The people like it. No big issues with this, no big mistakes, nothing. At the end, it's a tool to support the decision of the physician, no more. But the big news, and something has been very impressive, has been the massive adoption of the tool by the community out there, because we have a version public out there to facilitate the process of diagnosis, and this has right now every month around 20,000 users. Every month. It's massive. The adoption is massive and it's going up very quickly. Just to close, the doctors love this kind of tools. The people at the beginning say to us, okay, you will see the resistance of the doctor. No, 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 no. Something we realize is doctors need more tools because they care about patients. They want to provide diagnosis. If you provide a good tool, they will use it. They are not stupid guys, you know. The other thing is the large language models, all of them, the commercial models perform at a very high level. We are using GPT-4, but we did tests with other models, and they're performing very well in a very consistent way. So there are signals that the large language model can change the way we are doing medicine. Absolutely. Because the question is, what's the accuracy of the doctors? The real one. Nobody told me. And if you are looking in PubMed, medical information about the real accuracy of a doctor with no tools, diagnosing rare disease, there are no data. No data. We don't know. So, and it's very difficult to compare this kind of tools if we don't know about a doctor with no tool. Something very interesting as well for you. In our experiments, we did fine-tuning of large language model to see the accuracy of these models on rare diseases diagnosis, and not really a lot of improvement. The knowledge and the information in the large language model at ease is good enough to provide the same quality that professionals doing diagnosis for rare diseases. And we are in a situation where the doctors need the tool. And the doctors are surprised with the rise of this tool, but definitely we see the potential of these tools, because at the end, the beauty of large language model is that the mission of me, of my family, has been done in a very fast way because of that models, because they embed the knowledge and the medical knowledge of years and a lot of people. We don't want to make comparisons. We don't see these type of tools like competitors for humans. We see these tools like tools able to improve the cognitive capabilities of physicians. Because right now, they are in a level that they need supervision. And they need a human person checking the results and make the differential diagnosis. They are not powerful enough right now to be alone. They need a person. And probably if you ask me, as a patient, I want a person in front of me. I don't want just GPT-4. That's all. Thank you very much. You have the presentation in the QR.
Stay here because I'm going to be very brief and then we can talk. So I'm Susanna. I'm a pediatric neurologist and a clinical geneticist and specialized in rare diseases. And when I started in this field, I really actually studied from books, from real paper books. And I wrote all my notes in paper, and I had to really have in mind all the differential diagnoses. Everything has changed. Artificial intelligence is amazing. It's going to make my life much easier, and I will be able to take care of my patients from a better way, because I won't be writing on the computer at the same time that talking to them, so this is going to be really good. And however, as a managing director of pediatrics, I think, OMG, this is going to be difficult. We physicians are not very gifted at technology, usually. And our natural human resistance to change is going to make things difficult. Also, it's not the same to change the way you're doing things when you're 30 years old or when you're in your 50s or your 60s. So, as this is going to happen soon, there are some questions we have to face. How all this is going to change the role of doctors in the future. AI is going to redefine completely our job. AI is going to supply a lot of skills doctors are trained to do, but studying and memorizing is something doctors do since the beginning of times. Limits are in our brain, and this is the real challenge. I'm also a university professor in medicine, and what we have been living these last years is that our students are more and more intelligent every time. The most academic gifted students with huge memories can become doctors, while others, usually more gifted emotionally, are not. In the university, we're still teaching them theoretical lessons. They memorize them. Exams are designed to demonstrate knowledge, but not empathy or emotional skills. If AI gives you easy and more accurate access to that knowledge, what are doctors supposed to do in the near future? We have to become the interface between the patient and the machine. In order to do so, we must adapt and change everything that we have been doing until now. And maybe access to medicine has not to be related to academic grades, but to social and emotional skills. Julian, what are your thoughts about this? Can you help us to do that?
Oof, there are a lot of insights in your speech. But for me, I guess, the most important activity we have to do, I mean, the people working on technology, is to make sure we are providing the tools to remove the administrative work that you have to do. And because this big amount of administrative work that every professional has to do every day, I guess is taking time from patients. And definitely there is a lot of potential using the new technologies and AI in order to remove these boring activities that they are not providing any value. If everybody can do it and AI can do it, and we need to start from the beginning, removing these boring tools and free more time for you to spend with the physicians, with the patients.
Okay. So, if you have any questions?
Thank you very much. For us in journalism, they say that when you give a visual example of what you're doing, it's the best thing to help us understand what you're doing. So with Sergio, it's everything we need to understand. So thank you and congratulations for your work.
Thank you.
Thank you.
So it's lunchtime. There are food trucks outside. We don't have very much time to have lunch. I mean, we should be here around 2:15, 2:20 tops. So please, I ask you to be punctual. Thank you very much.